Good morning, all. On behalf of the Ministry of Health, I warmly welcome all participants to this consultative virtual meeting between the Chief of Staff and the Head of Public Service and the Ministry of Health in conjunction with the Council of Governors. We appreciate your time, presence, and continued commitment. I now invite Mr. Benjamin Murkomen to lead us in the opening prayers.
Almighty God, we gather today in gratitude for the gift of service and the responsibility entrusted to us as public servants. We thank you for the opportunity to contribute to the well-being of our nation and its people. Grant us wisdom in our deliberation, integrity in our actions, and unity in our purpose. May our work reflect justice, fairness, and compassion, ensuring that the policies we shape and the services we deliver uplift every citizen. Bless our leaders, families with strength and resilience, protect our nation from harm, and guide us towards peace, prosperity, and health. We commit this meeting and our duties into your hands, seeking your guidance in all that we do and all we say. Amen.
Thank you. Allow me now to acknowledge the presence of our chief guest, the Chief of Staff and Head of the Public Service. Also present are Dr. Ouma Oluga, the Principal Secretary, State Department for Medical Service, Mary Mudhoni, Principal Secretary, State Department for Public Health and Professional Standards, Mr. Ada Osia, the Principal Administrative Secretary in the Executive Office of the President, Director General for Health, Dr. Amoth, directors, CEOs, and the other senior officers from the Office of the Chief of Staff and Head of the Public Service and the Minister of Health, distinguished officers from across the government, and we reserve a very special welcome to each one of you, our invited participants who have flocked into this meeting from all across the length and breadth of this country, whether individually or in groups. This includes all staff of the Ministry of Health, all staff of the SAGAs of the Ministry of Health, all board members, all county government, health staff. I'll now go to the meeting protocol to ensure a smooth session. Share your full names, designation, and station or county when you are logging in. The session is held via Zoom and streamed live on the YouTube. The microphones remain muted. Use the raise hand function to contribute. Submit questions through the question and answer session. Use the chat for brief comments and introductions only. Session materials will be shared afterwards. You can also follow the meeting through Phillips Kosgei on Facebook, X, and TikTok. You can also follow through YouTube channel, Chief of Staff and Head of Public Service. It is my pleasure to invite now Mr. Ada Osia, Principal Administrative Secretary in the Executive Office of the President, to make his opening remark and proceed with the program. Karibu, Bwana Osia.
Thank you very much, Mr. Arake. Am I audible?
Yes, sir, you are.
Our chief guest and the host, the Chief of Staff and Head of Public Service, the Principal Secretary, State Department of Medical Services, Dr. Oumo Luga, the Principal Secretary, State Department of Public Health and Professional Standards, Mary Modoni, senior officials and staff of the State Department for Medical Services, State Department for Public Health and Professional Standards, Council of Governors and County Governments, all distinguished participants, ladies and gentlemen. Allow me to extend a warm welcome to all of you to this important engagement, which brings together leadership and staff across all cadres within Kenya's health sector. This session forms part of the ongoing engagement series of structured and consultative engagements across the public service. The Chief of Staff and Head of Public Service has been undertaking a deliberate and well-coordinated program of engagements aimed at strengthening coherence, reinforcement, unity of purpose, and sharpening strategic focus across the entire public service. These engagements are anchored on the broader revitalization and re-energization agenda, a flagship reform initiative designed to consolidate gains made, deepen institutional alignment, and renew our collective commitment to disciplined, ethical, and results-driven service delivery. With this reform agenda, while this reform agenda spans the entire public service, it is recognized that different sectors face distinct operational realities. Accordingly, tailored engagements such as this one are necessary to ensure that sector-specific challenges are addressed and that performance improvements are both measurable and sustainable. The health sector, being one of the most citizen-facing and impact-driven sector occupies a central place in this reform effort. The quality, responsiveness, and integrity of services delivered here directly shape public trust and national well-being. Sir, allow me to commend the leadership of the State Department for Medical Services, the State Department for Public Health and Professional Standards, and the Council of Governors for their exemplary coordination and mobilization efforts. Your commitment, particularly in ensuring participation of staff across all levels, even over the Easter period, is both noted and appreciated. Ladies and gentlemen, I'm pleased to report that under the stewardship of the Chief of Staff and Head of Public Service, this reform agenda has gained significant traction across government. Extensive engagements have already been undertaken across multiple sectors with encouraging results of uptake and emerging alignments. The ultimate objective is clear: to ensure that this revitalization and re-energization agenda permeates every level of governance and reaches every corner of the Republic, embedding a culture of accountability, discipline, professionalism, and results-oriented service delivery throughout the public service architecture. Above all, we must ensure that our efforts translate into a lived and felt experience for our citizens. The people of Kenya must experience a public service that is responsive, efficient, compassionate, and firmly aligned to their needs and aspirations. I therefore urge each one of us to take personal responsibility in cascading this message within our respective institutions. The conversation must continue to every level until the transformation we seek becomes visible, tangible, and undeniable. The Chief of Staff and Head of Public Service, with those few remarks, it's now my honor to invite the Principal Secretary for State Department of Public Health and Professional Standards, Madam Mary Muthoni, to give our opening remarks. Welcome, PS.
Osia, apologies, I'm trying to connect, so kindly invite my colleague as I try to settle down.
Thank you very much. Dr. Oluga, welcome. Dr. Oluga.
Thank you to Head of Public Service and the Chief of Staff. And thank you, Mr. Osia, for giving me this opportunity. I would like to say a very good morning to all our staff from both of the state departments under the Ministry of Health and those that are joining us from county governments. And secondly is to thank the Chief of Staff and Head of Public Service for this program on revitalization of public service that is meant to improve performance and efficiency in citizen-facing services. From the medical sector, we are very keen to ensure that all the programs of governments are implemented, and they are implemented with the expectations of the public being met. Today, we want to thank you, Chief of Staff and Head of Public Service, for bringing on board all the staff from the Ministry of Health so that they could feel part and parcel of the transformation that is going on within the health sector. As we are already aware, healthcare is one of the pillars of economic transformation that has been given key priority in the government agenda for bottom-up economic transformation, and healthcare being key to economic development. It means that we must work in tandem and we must work efficiently to deliver on the expectations of citizens. Sir, and all of our staff, we have been delivering on 4 key priority areas. One has been on health financing, where we have been keen to ensure that no citizen is left behind from accessing healthcare services because of financial hazards. Secondly, we have been keen to ensure that all staff are properly positioned to deliver healthcare services for the best experiences and the best outcomes across all hospitals in Kenya, whether those hospitals are public sector, private sector, or faith-based. Thirdly, is to ensure that we avail quality, safe products for healthcare performance, and whether these products are the x-rays and the equipment, or whether these products are the medicines or the non-pharmaceuticals that our health workers utilize to provide the services. And lastly, we have been keen to digitize the entire healthcare ecosystem so that we unify actions. We also have a digital footprint that gives us single source of truth and ensures that all our policies and plans are digitally backed and that all our reports are similar across the board, so that resource deployment and policy implementation happens in an environment of alignment, efficient coordination, and delivery of quality health services. So with those very many remarks, we want to thank you again for this meeting. And we want to take this opportunity to welcome all our staff from the State Department and also from the semi-autonomous government agencies that are joining us. And we look forward to this engagement as we improve efficiency and performance at optimal levels as expected. Thank you.
Madam PS, are you
Thank
ready?
you. Yeah, thank you very much, Chief of Staff, Head of Public Service, my colleague PS. Ladies and gentlemen, a very good morning, and apologies for the rush. First and foremost, it is my privilege to welcome you all to this consultative virtual meeting as we gather today to, under the mandate of the Executive Office of the President, we are reminded of our shared collective responsibility, and as stewards of the nation's health, our agenda today is anchored on 3 critical areas that define our service to the Kenyan people. And the first one is the constitutional fidelity, upholding the values and principles of public service as enshrined in our Constitution. The second one is operational excellence. And this is pushing our performance and efficiency to optimal levels to meet the growing needs of our citizens. And the third one is quality service delivery that ensures that we provide premier services that are qualitative, quantitative, and most importantly, delivered timelessly. As a State Department for Public Health and Professional Standards, we are committed to maintaining the highest benchmarks of health safety and professional ethics. Today's deliberations, ranging from the zero-fault audit status campaign to our collective efforts with the Council of Governors, are very vital steps towards a more transparent and effective healthcare systems. I look forward to the insights of our directors and the CEOs as we talk together, work to harmonize our efforts between the state departments and the devolved units. Our role basically is prevention and promotion of health services, and we are looking forward to ensure this is worked on in collective efforts between the two levels of government. Let us use this forum to reaffirm our commitment to the public that we serve. Thank you.
Madam PS, you are to invite the head of public service.
And at this juncture, can you hear me?
Yes, we can.
And at this juncture, I want to take this very opportunity to invite the head of public service to address this gathering.
Thank you. A very good morning, ladies and gentlemen, the peers, public health and professional standards, our peers of medical services, senior government officials, and all officers under the health sector, and also those who are in the secretary of the president. Good morning and welcome to this meeting. I want to take this very, very opportune moment to welcome all of you to this serious space of discussion. We've started this journey. We've had discussion in various sectors, but the most critical sector, in my view, is the health sector, where we really are operators directly linking our government operations with the people directly. The services that we offer is felt, seen, and recognized by the people in as far as either quality, either progress, or effectiveness and efficiency in our space. So I want to really urge you to be attentive, to focus, so that we can proceed and have a conversation that will contribute towards our journey to Singapore, our journey from the current middle-income country to the first world, a country that will have a healthy systems, a country that will see transparency, we will see accountability, we will see corruption being slayed, and more importantly, we will see professionalism being demonstrated by our people. So I want us to really, really, really settle down in this meeting. I can see about 9,500 plus people are connected. So I want all of us, as a people, as a sector, as a people who have been given a chance and a privilege to serve the people of Kenya in the health sector, to have an open mind, let us contribute, let us have discussions, and more importantly, let us go back home after this meeting with a very clear roadmap on how we can try to turn around the gains and make sure that our sector, that is the health sector, is operating optimally, and it is a sector that people would say, yes, we have men and women who are really public servants that serves the people of Kenya with zeal and commitment. Thank you. and welcome.
Thank you very much, the Chief of Staff and Head of the Public Service, Mr. Felix Koskei, for those remarks, and also to our Principal Secretaries from the State Department for Medical Services, as well as the State Department for Public Health and Professional Standards. I just want to repeat the welcome that has been made by my colleague earlier on this call from the State Department for Medical Services. And I just want to say that for everybody who's in this meeting, Karibu Sana, ensure that you go to the chat section. If you look at the bottom of your screen, you will see the icons at the bottom there. One of them is called chat. And in the chat, we are writing our names, our designations, our stations, the counties where we are. And if we're seated in groups, remember that all the names of the persons who are sat in the group need to be written in that particular message. And then you post it there so that we can know who's there. And then remember, this is a webinar, so all microphones are switched off except for those who have a speaking role and for the plenary when we get to that section. I also want to bring to your attention that you have a Q&A section at the bottom of your screen. We have a team from the 2 state departments who are on standby to respond to your questions, things you've been wanting to ask, things you've been wanting to know about the policies within the state departments. And if you're in the county, a special welcome to all of you who have joined us on this call. We're grateful to the Council of Governors for partnering with the Chief of Staff and Head of the Public Service in this meeting to be able to bring all of you on board. And we believe that having participated in this meeting, both state departments and the Council of Governors on the health function will continue to have your own Zooms as you bring others more and more into the fold so that we are working uniformly in our journey to Singapore, where we all want to be able to go. I just want to also repeat that you're going to receive all the material that is going to be spoken of in this meeting, and that material includes all the presentations that have been made. You'll receive the speeches that are made, so you don't have to worry. You can continue to study this material after this meeting. To also remember that you can be able to follow the Chief of Staff and Head of the Public Service on his socials. That is Felix Koskei on Facebook, X, and TikTok, as well as if you look on the YouTube, you'll also be able to find him there under Chief of Staff and Head of the Public Service. So at this point, I just want to be able to welcome my colleague, Collins Kiprono, to be able to set the context of this meeting and let us know how the Head of Public Service comes, the reason why he has invited us and this program that he has been on. Let us kindly remember that as our Principal Administrative Secretary said, that this is a series of programs being carried out by the Chief of Staff and Head of the Public Service to be able to bring the public service together in one accord when it comes to service delivery. You will be able to note from the program when you receive it that this is what we are on about today. This is our collective responsibility as public officers in implementing the constitutional values and principles of public service, as well as improving performance and efficiency to optimal levels, and finally, to provide premier services to the public qualitatively, quantitatively, and timelessly. So again, a very big welcome to all of you. We're delighted you could join us. And indeed, a big congratulations to the state departments as well as the Council of Governors for their massive efforts throughout to be able to mobilize the numbers today. Karibuni. So Collins, and as we proceed, I think it's important to point out to all speakers that we're trying to cut time as much as we can. So given that the presentations are going to be given to everyone, we would urge that you focus perhaps on pointing out those items that are key, because members will get these presentations, and also to write on the protocols that have already been established in order for us to be able to save time. So kindly, if you could just say your name and proceed with your presentation, that will be in order. I want to say that after Collins will be followed immediately by Dr. Andrew Toro, who is the Director, Curative and Nursing Services. Dr. Toro will be followed by Dr. Joel Gondi, who is the Director, Primary Healthcare Services. And Dr. Gondi will be followed by Professor Mutaha Kangu from the Council of Governors. from where then I will come back to intervene. And if we are not speaking, let us have our cameras off and let us have our microphones off so that we can then be able to be together. Thank you very much, Collins.
Thank you very much, Dr. Chief of Staff and the Head of Public Service. I'll rely on the protocol that are already established. My name is Collins Kiprono. I'm the Secretary of Legal Affairs at the Executive Office of the President under the leadership of the Chief of Staff and the Head of Public Service. My duty this morning is just to set context. And before I do a deep dive in terms of the context, I'd wish to take the next 2-3 minutes just to give an understanding on the functionalities and the Office of the Chief of Staff and the Head of Public Service. So, colleagues, this office is established pursuant to Article 132(4) of the Constitution, which provides that the President may establish any office as he may deem fit or she may deem fit for the implementation and undertaking of the mandate under the presidency. This office has further been ratified through the National Government Coordination Act, that is Act number 4 of 2024, and with particular reference to Section 8, and that goes to Section 8.3, that speaks to the establishment of the office of the Head of Public Service, who shall be an office within the public service. This act goes further under subsection 4 to state that this appointment shall be done with the recommendation of the Public Service Commission, and further under subsection 6, it provides that the Head of Public Service shall double up to be the administrative head of the executive and shall perform any duties as assigned by the President. And it goes further to state that the Head of Public Service shall double up as the Chief of Staff to the President. So, in essence, this office is established in law, both Parliament and the Constitution, and this codification of the functions are further done under the Executive Order number 1 of 2025, which has codified 8 high-level mandates of this office, and I'll just speak to 6 of them that is relevant to today's session. Number 1, the Chief of Staff and the Head of Public Service acts as the administrative head of the Executive Office of the President, and by acting as the administrative head, he or she ensures that the functionality and the workings within the Office of the President that is done in a seamless manner, in a manner that is coordinated, and the President can be able to address other issues while the Chief of Staff and the Head of Public Service works on the entire public service. Number 2 function is the overarching mandate over all public entities. And colleagues, for us to be able to understand where we come in, the definition of public entities is all entities or organization where funds and procurement are done from the consolidated fund, where procurement of goods and services and performance of this mandate and records which are kept are done on behalf of the public. And that is where you find all of us fall within the purview of public entity. So the Chief of Staff and the Head of Public Service has the overarching mandate of ensuring that these public entities are operate in a manner that is synchronized, in a manner that ensures that there is no overarching overlap in terms of mandate. And again, this function is done at the behest of the President. The third function that colleagues I wish to speak to is the aspect of the promotion of ethics, good governance, efficiency, and effectiveness within the public service. And this is done to ensure that there is provision and deployment of the rightful skills, the rightful values, and leadership within the Kenyan public service, so that we ensure that doctors are placed in the rightful place, and not a statistician asked to act as a physician. A lawyer is not asked to act as a pharmacist. So this role is undertaken in conjunction with all other public entities, the different HR departments in our institutions, the Public Service Commission, our different boards when they are hiring. So this is a role that is undertaken in conjunction with the different entities that got us into office. The fourth function is the transmittal of executive directives, that is the orders, presidential proclamations to the different MDAs, to ensure that the rightful information is cascaded, the implementation and further action when need be. We notice that, colleagues, we receive these circulars from different entities, be it the Ministry of Health, be it the National Treasury, be it the Office of the Attorney General, be it the Public Service Commission, Salaries and Remuneration Commission, and even our different county agencies, that is the counties when they are communicating and cascading the different transmitter. This is a role that the Office of the Chief of Staff and the Head of Public Service also mandates. The fourth role, the second last, is the transmitter of policy advisories by way of circulars within the public service as may be originated from the executive. And now, speaking to all of them is the Chief of Staff and Head of Public Service is responsible for the overall effectiveness of the public service. And that is where, again, we all fall in. Now, let me just go now to the context. I'll go to the next slide. Now, this issue of the healthcare is, as stipulated by P.S. Oluga, is a priority, and it falls as one of the pillars of the bottom-up economic transformation agenda. Therefore, the State Department for Public Health and Professional Standards sits at a very key position in ensuring that the shared health system at the national level sets policy, norms, standards, and has a coordinated framework and oversight, while counties at the same time ensures that they carry the core devolved health function, such as the county facilities, pharmacies, the ambulance services, promotion of primary healthcare, food establishment control, categories and criteria, and the refuse removal and the solid waste disposal. So Kenya's Health Act is built this national and county interrelationship, so that many of the sector's emerging issues are real issues which are intergovernmentally aligned, and the implementation and capacity and accountability is a shared function between the national and the county function. That is a reality that we are all aware, and the interdependence while performing this role is at the key of today's session. Now, having now given the overview, our key responsibility as public officers are threefold, as we've pointed out in for today's presentation. One is the implementation of the constitutional values and principles of public service, the improvement of performance and efficiency to optimal standards, and this again feeds into the issue of providing premier services to public in a qualitative, quantitative, and in a timeous manner. And now, speaking to the first high level overarching issue, the implementation of the constitutional values and principle of the public service, the continuous improvement and performance of public delivery in the public service is a core promise and mandate under priority under this administration. This is anchored under Article 10 of the Article 10 and Article 232 of the Constitution, which mandates, as you can see in the slide that is projected, mandates the issue of integrity, mandates the issue of accountability, mandates the issue of high ethical standards in performing of our mandate. To ensure, again, that there is harmony between the levels of government, we make reference to Article 189 of the Constitution, which anchors and guides the shared responsibility between the two levels of government, so that as we are calling for accountability and responsibility of these functions are a shared responsibility. And the Constitution has been able to breathe light on how this responsibility is managed and how this responsibility is expected to be performed. Now, the second issue that we thought it is important for today's presentation, go to the next slide, is the issue of improvement of performance and efficiency to optimal levels. And for this particular limb, we've given a four-pronged approach. We've provided 4 high-level issues that now the experts and the professionals that will be making the presentation subsequently will speak to. Now, the first one being a structural efficiency, the primary healthcare shift. This is one of the most significant gain that has been curated and carved to ensure that we pivot from the expensive hospital-based curative care to a preventive first model, which came into force with the enactment of the 4 pieces of legislation that were assented to at the beginning of this administration's tenure. And to this extent, it speaks to two critical issues. That is the primary care networks, the PCNs. And we note from the statistics that we've been able to get from the different entities that by early 2026, the 228 PCNs have been established across the 47 counties. This is the hub and spoke model, which links the level 4 hospitals with small healthcare facilities that ensures there is a streamline referrals and reduce the congestion within the tertiary facilities, so that you find someone with headache or someone with just a basic injury, soft tissue, going to a referral hospital. So these primary care networks has been able to curb that in a huge way, and goes in a long way in ensuring that the right services are rendered for the right for the right needs at that particular, and which goes in a long way in terms of saving the costs to the government. The second limb under that is the issue of the community health workforce, which there's been a deployment of more than 107,000 community health promoters, which has bridged the last mile with over 8.89 million households are now registered under the Electronic Community Health Information System, the ECHIS, allowing for real-time screening of chronic illness, which ranging from diabetes, hypertension, and maternal health care risks. This speaks to the ensuring that these services are done to optimal levels. The second high-level limb is the issue of the digital transformation and accountability. So paper-based systems were primary source of efficiency, and now which brought to the fore the issue of leakages. Now, with digitization, the digital healthcare agencies, as it was established again under the amongst the 4 pieces of legislation that were enacted at the beginning of this regime, which established and has overseen the transition of this agency to the adoption of the electronic health records, the EHRs, and as of 2024-2025, I'm sure this number is higher. Our colleagues from the ministry would state 69% of the facilities, or is it now 70s, are previously lacked digital systems. However, the ongoing rollout and the Taifa Healthcare aims at ensuring that we have 100% transition to interoperability by 2027, which ensures that there is efficiency and optimal levels in terms of rendering the medical service. Equally, the other trailblazer is SHA, the Social Health Care Authority, which came to replace NHIF, apologies, which ensures that SHA utilizes the means testing system to optimize allocation of subsidies, ensuring the financial protection reaches the bottom 20% of the population, which ensures again efficiency to the population in a timely and efficient manner. The third high level is the human resource optimization. So the workforce density, Kenya faces the double burden. That is a shortage of workers and inequality in the distribution of this little available workforce that is already dwindling, or it is not sufficient when it comes to the service. So the workforce density of doctors is still low, and I'm sure the initiatives and their policies that have been put by both county governments and the Ministry of Health to be able to address that. And this again is intertwined with the issue of the workload indicators for staffing needs, which is again a data-driven approach, which moves staffs from the overserved urban centers to the underserved rural wards based on the actual patient volume. But now, I'm sure now equally our colleagues will speak to it, but that is the other concern that we need to address to ensure that the performance are done to efficiency and optimal levels. The other issue, the third issue, is the human resource optimization. Strategic investments have yielded measurable improvements in systems efficiency within the health sector, and this has come by the outcomes that speak into it. And you notice that maternal and child health is one of the key issues under that particular limb, with skilled birth attendants increased by by around 80% or 75 to 80%, and now a reporting of an achievement of 80% by the end of this financial year. The issue of the disease suppression, HIV suppression has reached about now by that is December. But when we had the National AIDS Day, was it in December 1st, there was an indication that this has reached about 95.5%, which meets our global fast targets. So we are a trailblazer in that particular field. Equally under it, the issue of the quality of care, facility case fatality rates have gone down, which speaks again to the issue of optimal utilization of that particular limb, and this is signaling a better clinical management at county level as well. So this is props to equally the workers from the county governments that they are actually undertaking their mandate. Now to the last limb of my presentation on providing premier services to public in a qualitative, quantitative, and a timely manner. There are 6 issues that are arising from it. One, alignment of all. Go to the next slide. Alignment of all health policies, laws, and strategic plans with the constitutional values. Establishment of a strong governance of and ethics accountability structures across both state departments and the county governments. Merit-based, inclusive, and performance-driven human resource systems. Efficient, transparent, and patient-centered service delivery that supports a digitalization and clear service charters that we are expected to provide, a robust monitoring and public participation and reporting mechanisms that we need to put in place as both the Ministry of Health and the county governments, and finally the harmonization of health and of health standards across the counties. This ranges from the health records, the available data, because we are a data-driven economy, so data is at the heart of everything that we undertake as the health sector. Finally, as the conclusion, so the central messaging that is coming out very clearly is that the Kenya's health sector can only succeed. That is the next slide. Through an integrated whole-of-government approach that ensures the national policy, county implementation, and professional standards and public accountability work in harmony to deliver equitable, quality, and sustainable health services to all citizens. Because all of us, colleagues, remember that our number one clients remain the citizens. Every policy, every decision, every deliberation that we come out should be centered around the citizens, because we are doing everything that is citizen-centric, that ensures the citizens are content for the services that is being rendered to them. Thank you. Please, the next presenter has been elected by Dr. Linda Musumba. The floor is yours. Andrew.
Dr. Andrew Toro.
Andrew Toro. Yeah, Dr. Andrew Toro. Yes.
Yes, thank you so much. Please, you can put up my presentation. Allow me to put up my presentation. Thank you so much. The Chief of Staff and Head of Public Service, Mr. Felix Koskei, our 2 Principal Secretaries, our Director General for Health, riding on the established protocols. My name is Dr. Andrew Toro. I am the Director responsible for curative and nursing services, and it's a pleasure and privilege to take you through an overview of the State Department for Medical Services. Let's go to the first slide. So the first slide is basically where our mandate is drawn from. And as stated previously by the previous speaker, the health sector is in two levels, the national and the county. And the functions for the national level are as follows. One is the formulation of health policies. And two, the development and enforcement of all health regulations. We are also responsible for the management and coordination of all national referral health facilities. And last is provision of capacity building and technical assistance to county governments. These are the functions that we are responsible for at the national government. The other functions are devolved in the counties. Let's go to the next slide. The Executive Order number 2 of 2023 has further elaborated the core functions of the State Department for Medical Services as follows. We are responsible for all curative health services which are rendered through our national referral hospitals. We are responsible for the social health insurance policy. And as stated earlier, all national health referral services is our mandate. And to combat the ever-rising cancer, we have a cancer management policy. We are also responsible for digital health systems. We have a mandate on immunization, reproductive health policy and management, and also to combat the non-communicable diseases control and management. It is also our responsibility to control and prevent HIV/AIDS and other sexually transmitted infections. Let's go to the next slide. So our State Department has several semi-autonomous government agencies, SAGAs, and the following are the key ones. We have the Social Health Authority, whose core mandate is to implement the universal health coverage, UHC, and they do this by managing social health insurance funds and claims. We also have KEMRI, the Kenya Medical Research Institute, whose core mandate is to conduct national health research, and using the research findings, we are able to inform policies, strategies, and plans. We also have another SAGA, Kenya Medical Supplies Authority, KEMSA, whose core mandate is to procure, to manage our stores, and to effectively distribute medical supplies and essential medicines to all our public health facilities. The core mandate to spearhead the digitization of health records and to have a national integrated health information system is domiciled within the Digital Health Agency, the DHA. And we have the Kenya Biovacs, whose mandate is to manufacture vaccines and biopharmaceuticals locally to ensure commodity security. Let's go to the next slide. Additionally, we have specialized institutions within our State Department which support our national health priorities. And key amongst them is the National Cancer Institute of Kenya, whose core mandate is to coordinate national cancer prevention, control, and policy formulation. At the same time, we have the National Syndemic Diseases Control, which assists in managing the national response to syndemic diseases, including HIV, tuberculosis, malaria, and sexually transmitted infections. We also have the Kenya National Blood Transfusion and Transplantation Services, whose mandate is to ensure security in terms of blood and blood products. Other key semi-autonomous government agencies are our national referral hospitals, and we have 7 of them. Key is the Kenyatta National Hospital, which will be celebrating its 125th anniversary this year. We also have Moi Teaching and Referral Hospital. We have Kenyatta University Teaching, Referral and Research Hospital. And we have Mwai Kibaki Referral Hospital, Jaramogi Oginga Odinga Teaching and Referral Hospital. And finally, to manage spinal injuries, we have a National Spinal Injury Hospital, which is found here in Nairobi. Ladies and gentlemen, the State Department's vision is aligned to the Ministry of Health vision, and this is to be a globally competitive, healthy, and productive nation. And we do this deliberately by progressive, responsive, and sustainable, technologically driven, evidence-based, and client-centered health systems for accelerated attainment of the highest standard of health to all Kenyans. Sir, our goal is to attain equitable, affordable, accessible, and quality healthcare for all. Next slide. Sir, for us to implement the above functions, we have an organizational structure whose benefit is to ensure proper coordination and communication between the various directorates. We have our cabinet secretary at the top with our principal secretary, who is the authorized officer and accounting officer. And there's a link between the SAGAs and the accounting officer. And we have the head of technical services within the State Department, who is the Director General for Health. We have 4 key technical directorates, namely the Directorate of Curative and Nursing Services, where we have several divisions, as stated there. We also have the Directorate of Family Health, and then we have the Directorate of Health Products and Technologies. And finally, amongst the directorates, the technical directorates, we have the Directorate for Health Financing, Digital Health, Policy and Research. We have a 5th Directorate on Administration, which supports the technical directorates. And this way you have the administration, human resource, finance, accounts, legal, and supply chain. Next. Next slide. Article 43 of the Constitution guarantees every person the right to the highest attainable standard of health. And this includes access to health care services, reproductive health care, and emergency medical treatment. The government, through our ministry, has identified healthcare delivery as one of the core pillars of its bottom-up economic transformation agenda, the BITA. And in line with this plan, we have a number of commitments which have been identified towards the delivery of the UHC. These interventions include: 1, having a fully publicly financed primary healthcare, which comprises of preventive, promotive, curative, palliative, and rehabilitative services. We are also integrating information communications and technology systems, and this is to enhance telemedicine and health information systems. At the same time, we want to ring-fence funds for healthcare from facility improvement funds to allocations from the National Treasury and in collaborations with our county governments. We are also setting up an emergency medical treatment fund, and this is to cater for emergency cancer treatment and referrals. Let's go to the next slide. Next slide, please. So in the recent past, we have 4 major laws which were enacted, and they were enacted so that they could support our universal health coverage. And these are namely the Social Health Insurance Act, which established the Social Health Authority, which is mandated to manage the National Health Insurance Funds. We also have the Primary Healthcare Act, which is a framework for delivering and managing community-level health services. Third, we have the Digital Health Act, which was established in 2023, and it established the Digital Health Agency and a unified national health information system. And lastly, we have the Facility Improvement Financing Act, which manages the funds which are collected by public hospitals and are invested directly to these facilities. Let's go to the next slide. Sir, I now want to turn to our recent achievements. And key amongst them is that we have over 30 million Kenyans who have been registered with the Social Health Authority. This is a significant milestone, given that just in late 2024, we were at the 13 million mark. We have been able to improve this mark by 17 million. The ministry has also rolled out the Mwalimu Comprehensive Medical Cover since December 2025, and this has benefited in excess of 400,000 teachers. And just last week, we were able to onboard the National Police Service and the Kenya prisons, who will continue to benefit from the SHA. Sir, we have the health benefits package, which has continued to be enhanced. And recently, we have the cancer care coverage, which has been enhanced from 550,000 to 800,000. And this is to incorporate PET scans, radiotherapy, and chemotherapy. We also have the maternity and child health, Linda Jamii. This is a program that has evolved from the Linda Mama to the Linda Jamii, and this now covers entire households for vulnerable mothers rather than the one previously which only covered mothers and newborns. Let's continue. Next slide. We also have one of our facilities, the Kenyatta University Teaching and Referral Hospital, which has made a tremendous achievement. It has so far been able to give 18,000 patients chemotherapy and radiotherapy, and this again is a target of 23,000. We also have KEMSA, which has achieved another milestone of 91% order fill rate for all national health products and technologies. 1,600 facilities cutting across 28 counties in the country have been digitized, courtesy of the Digital Health Agency. And sir, we have the establishment of the East African Center of Excellence in Urology and Nephrology, which is now complete and should be operationalized very soon. Next slide. In Mwai Kibaki Referral Hospital, we have a multidisciplinary consultative initiative, which has resulted in the reduced average length of stay for trauma patients, coming down from 17 days to 12 days. At the Moi Teaching and Referral Hospital, we have been able to start construction of a state-of-the-art new 4,000-bed multi-speciality hospital, which will go a long way in covering the workload in the northern parts of Kenya. In addition, Moi Teaching Referral Hospital continues to be the only public hospital which is doing corneal transplants. And by mid-year, they had already done 26 of these transplants against an annual target of 40. At the Jaramogi Oginga Odinga Teaching and Referral Hospital, they have also made tremendous achievements, and they have already achieved 449 red blood cell exchanges. This is to our sickle cell disease patients, and this is against a target of 100. Next slide. Sir, allow me to take you through some of the challenges that we experience as we implement our mandate. The first one is the ever-increasing burden of non-communicable diseases and other emerging health conditions. And this has resulted into a double burden, where we still have the communicable diseases and now we have the non-communicable diseases. At the same time, sir, we have inadequate budgetary allocation, which have affected some of the essential programs, especially the one on reproductive, maternal, child, newborn, child, and adolescent health. The one which has also affected family planning commodities, HIV programs, and the blood transfusion services. We also experience challenges in underfunding of SHA, especially the two main government finance funds, namely the Primary Healthcare Fund and the Emergency Critical and Chronic Illnesses Fund. Sir, we still have the NHIF legacy debt of 5.4 billion, which was incurred during the transitional period of the NHIF to SHA. Next slide. As I come to the conclusion of my presentation, sir, we continue to experience inadequate budgetary allocation, and especially this is in the view of reduced donor funding. We also have challenges in inadequate human resources for health, both in numbers, specialty, and skills mix. We have also been experiencing huge pending bills and court awards and these have resulted from non-payment of historical pending bills. Sir, we also have inadequate health infrastructure and aging equipment in some of our referral hospitals, and this has affected the quality of health services. Finally, sir, next slide. Allow me to give key recommendations from our state departments as follows. We would like to scale up the universal health coverage so that we can cover more households and at the same time ensure onboarding of the informal sector who have been left behind. We also want to invest in local manufacturing of essential and specialized health products. This is very key towards ensuring that health products and technologies are affordable and easily accessible. We also want to identify alternative funding, and this will go along with bridging the funding gaps that have been left by the exit of our development partners. We also want to lobby for increased exchequer funding so that then we have enough resources to implement our mandate. We also are coming up with strategies to address the human resource for health inadequacies, as well as strengthening their capacities. We'll also continue scaling up of ongoing digitalization of health services, and this will be able to give us effective and efficient services within our public service delivery. And lastly, sir, we want to establish Kenya as a health tourism hub, and this is to cover the 10 neighboring countries so that then we are able to reduce the migration of our patients abroad, and instead we reverse it so that we have more patients coming to Kenya. Thank you very much, sir. That's the end of my presentation. Thank you.
Thank you very much for the presentation, Dr. Toro. And maybe you could make a comment on the oversight role of the State Department, just so that, right from the Chief of Staff and Head of the Public Service all the way to your, to your stakeholders, they can be able to understand that role just in maybe a minute. Dr.
Thank you so much. Like I said, the State Department of Medical Services is mainly responsible for implementing curative services, and this we do through our various SAGAs, National Teaching and Referral Hospitals. At the Ministry of Health, we have 4 major technical directorates, and the first one is that of curative and nursing services, which I'm privileged to lead. And we have various divisions underneath. So we have the division of nursing, which ensures that all nursing services are rendered effectively and efficiently. We also have the division of clinical services within the same directorate. We also have a key division of pathology and forensics. This is to ensure that we are able to know the cause of death for all fatalities that result. We also have a division which is responsible for palliative care and aging. We also have a division responsible for national referral services and medical emergencies. We have a directorate responsible for family health, and this is where we have the reproductive, maternal, child, and newborn care. We also have mental health services division. We have a non-communicable disease division, and we also have a division which is responsible in combating HIV and AIDS. We have a third directorate that is responsible for policy and research. And we also have the fourth technical division, the fourth directorate, which is responsible for health products and technologies. We are organized that our cabinet secretary is our leader. We have our principal secretary, Dr. Ouma Oluga, and then we have our technical head, who is the director general, and the 4 directorates together with the directorate of administration all report to him. Over.
Thank you very much, Dr. Toro. As I welcome Dr. Gondi to come and make his presentation within the next 10 minutes. The reason why I've asked that question, Dr. Toro and also Dr. Gondi coming, as well as our principal secretaries who are within this forum, is to be able to draw a connection for the participants who are in this meeting to be able to understand one of the things that the Chief of Staff and Head of the Public Service has been pushing, which is the prompt corrective action, as well as immediate administration of lawful consequences for infractions in the public service, so that from the top, where you have the State Department with the principal secretaries, all the way to the last man and last woman within the State Department, that there is a continuous thread, whether of training, a continuous thread of supervision, a continuous thread of improvement, because this is all meant to enhance and improve public services. So karibu Dr. Gondi, as and I said, will be followed by Professor Kangu from the Council of Governors. Thank you.
Thank you very much. 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 Sorry for that. Thank you very much to the Chief of Staff, who has held the public service, Mr. Felix Kosgei, our two principal secretaries, Madam Mary Mundoni and Dr. Umoluga, the CEOs who are here, colleagues from the Ministry of Health, and ladies and gentlemen. I'll ride on the protocols that have been established. I'll go straight to the State Department of Public Health and Professional Standards. Mine will be a little bit easy because most of the issues, administrative issues, we share with the medical services in terms of some needs and some of the challenges. So I'll go quickly on them. Next. Yes, the State Department derives its mandate from Executive Order number 2, 2023, where we have public health and sanitation policy, preventive and promotive health services, human resource development for healthcare workers, health education management, food quality, hygiene and nutrition, quarantine administration, radiation policy, and control of TB, other lung diseases, malaria control. If you look clearly at this, most of our mandate is happening at the bottom. And working towards the bottom up. And we do this in the prism of the Constitution, where we work with the counties closely, with the collaboration and partnerships, and also where we use the 4th schedule to guide our services. Next. Next. Yes, the vision, I think, nation free from that one is next. Yes, the State Department is organized where we have the directorates and divisions, and a lot of the functions are also done through the sagas. And we have 5 directorates where we have the primary health care, which has 9 divisions, in the health sector coordination and intergovernmental relations, which has 3, health standards, regulation, quality assurance, which has 4, the public health and sanitation has 5, and we have the administration, which has 6. And we have sagas, central government agencies. Most of them largely are dealing with health professional regulation, but we have service providers, including Kenya Medical Training College. We have the National Quality Laboratories. We have the Kenya Hospital Trust Fund. We have the Pharmacy and Poisons Board, which does both roles. And these sagas implement the mandate of the State Department. Next. Yes, our key results areas are largely around prevention, protection of the population, where we are dealing with the public health, and on the prevention of the key respiratory diseases, including malaria and tuberculosis, human resource training for health workforce. We have regulation, the labor dynamics, primary healthcare services. School health is a major place of our function, and we're dealing with drug and substance abuse, nutrition and wellness, health promotion and education, disease surveillance, detection and response. We're doing health education. We're doing national emergency preparedness and disaster, environmental health and sanitation, public health research, utilization and innovation, public health policies, guidelines and standards, and public health sector intergovernmental coordination. Also, we are doing global health diplomacy, which is becoming increasingly useful and necessary in the event, in the world which is interconnected. Next. Yes, as we're aligned to the better agenda, where we are handling the healthcare, afya mashinani, where primary healthcare, which was ably described by the earlier speaker, is residing. Next. Next, please. Yes, under this, primary healthcare, the government chose primary healthcare as a key driver for the achievement of universal health coverage. And the various acts that were stated earlier are actually enablers for us to achieve primary healthcare and the Health Act. This transformation ensures that now services are focusing on preventive and promotive, and is citizen looking in terms of ensuring that there is ownership, there is empowerment, and there is equity across the country, so that nobody is left behind. Next. Next. Next slide, please. Yes, so this paradigm shift ensures that curative care is important, but we focus on now preventing diseases from happening, promoting health, so that wananchi are empowered and they take care of their health. They take services which are from the household coming upwards. We are investing in ensuring that they're usually invisible services that are not easy to see, but actually have higher returns in terms of public health are prioritized. We are ensuring that there is integration at the service delivery level, was described earlier, where there is focus on multidisciplinary teams that work together, that are trained, that are empowered, linking with the community, where we have community health promoters who are trained to screen, offer basic services, and refer and link to the services, so that there is a seamless service provision across the spectrum of health. And this also ensures that we have structures which are not fragmented. And currently, we have in the counties, we are targeting to ensure that all the private care networks, the 315, are activated. We have currently the 268, where services are offered seamlessly by teams which are trained, dedicated, and empowered. And all these are supported by a network of community health promoters who are kitted to do basic investigations, screen, and offer basic services, and refer to our level 2 and 3 facilities. And of course, with this also, we have the financing bit, which was been a big problem. We have the primary healthcare fund now that is reaching our facilities, and facilities are empowered to offer basic services in their essential services in the facilities, and also to support community level activities, which ensures that we reach everybody in the community. Next. Yes, I would like briefly to talk about some of the issues that we are still working on to better approach that we have. We are looking now at, besides giving the services, quality of care is key in the provision of services. And therefore, we are working on the quality of care and patient safety bill, which is looking at having a framework where patients are protected. There's a framework for ensuring that health workers are licensed, facilities are accredited, and safety becomes a corner of our service provision. This is a bill currently in Parliament. We, as a State Department, we are looking at revising the Tobacco Act of 2007. We are looking at how do we ensure that aspects about the novel products, tobacco products, the issues of advertisement of tobacco, and the advertisement and sale and promotion of tobacco is controlled. This amendment is in Parliament, and it will help in controlling tobacco consumption and use in the community. We are also developing the primary healthcare regulations, which will now translate and empower the Act into manageable areas and help our counties and communities implement more, and also ensure that there is sustainability in the implementation of the Act at the grassroots level. Of course, it is important to note that Kenya has never had the healthcare professionals policy, and currently it is exciting to note that we are working on a policy that will ensure that we address the issues around production of healthcare workers. What skills do we require? What are the needs? Where do we need them most? And how do we ensure that we optimally use them and train healthcare workers in this country? This is has been published with public participation. It will define also, amongst other things, how health workforce mobility is affected in this country, so that skills can move and we can optimize utilization of healthcare workers. Again, we are looking at the issues of school health policy. So the country, we have about 15 million learners, and these 15 million learners go to about 50,000 institutions, which have different ways of looking at their issues around safety, issues around nutrition, issues around how they stay in terms of their care, the definition of how there are congestions in these schools. And as we move towards Singapore, we need empowered communities. Children are the agents, as students are the most powerful agents of change in terms of learning and translating that information to other people. We are developing this school health policy to ensure that this is affected, and across the country, we have people empowered who can have information, and our children are also protected while in schools. We have had issues of fires, we have issues of tuberculosis and airborne diseases because of lack of standards for school health. So this is work in progress. We are the policy is under development. The other one is the nutrition policy and dietetics policy. So in this country, you will go to the supermarkets, you'll find we have very different ways of food labeling. Some are in foreign languages. We have we have foods that have so much high sugar levels. Some commercially produced foods have fats that probably needs to be controlled. We have malnutrition among children, and we have almost 0.5% of our women of reproductive age who are overweight. And unfortunately, also, we have our boys who are between 15 and 19 underweight, and we have macronutrient different deficiencies. These issues surround issues around lack of a clear framework to guide our food and nutrition issues in this country. We are developing this policy to guide the country. How do we feed our children in schools? How do we ensure that there's proper nutrition and there's lack of malnutrition for our stunted children and wasted children? This will change the landscape in this country as we move forward. Next. Also, sir, as we said, we are moving now on focusing on preventive and promotion. Wellness becomes a cornerstone of our health policy. Wellness doesn't wait for people to be sick to be sorted. Wellness ensures that the environment is right. We are countering non-communicable diseases, which is becoming the leading killer and the leading cause of sickness in our population. We must design programs that ensures that people strive to remain healthy and where they are. So this is a policy that we are also developing. And of course, we are working also on the disability mainstreaming policy that will ensure that everybody has access to services across this country and everybody is supported. Next. Yes. The other areas that are key that we are working on, as I said, regulation of practice and training for healthcare workers is very key. And because of this, all our professional regulatory bodies and KEPO are working to ensure that we have oversight, we enforce standards, and all this is geared towards ensuring patient safety. We are also having health security is key for this country. All of us remember during COVID period, we know that if health security is not ensured, then economic prosperity and national stability becomes a challenge. So through NPHI, which is the National Public Health Institute, the State Department is ensuring that the intelligence, the surveillance, disease surveillance, preparedness, response is apt and responds to the 717, where within 7 days we should be able to detect an outbreak, report it within 1 day, and control within 7 days, within whether it's from outside the country or within this country. And of course, we are also looking at, when we look at this, we're looking at how sustainable are these issues and policies that will support implementation. As I said, primary healthcare and preventive promotive is happening at the bottom up. And then, of course, as we do this, collaborative approach is key. We work collaboratively with the with the county governments through the intergovernmental relations. We are working closely with partners. Most of our activities are supported through partners, whether public and private. Almost half of our services is provided by private sector. So partnership is very key for us to ensure that there is a continuity of services. Next. Yes. Briefly, sir, summarized, because my colleague also addressed this. Sir, HRH challenges is one of the major bottlenecks in this sector, whether it is staff shortages, in-post versus the establishment. Stagnation is a major thing that I know you'll hear as the floor is opened. Stagnation, this has root causes that we can, and our technical can be discussed. And of course, one of the big issues, the lack of framework for labor movement, the intergovernmental and inter-county movements of skills. Sir, for the country to succeed, you will want some of the best also practitioners that have put their hands on the ground at the county level, community level. We want people who have skills at the national level to go and deliver services at the county level, so that free movement, we need that mechanism to ensure that the sector is supported. And of course, financial risks, the global health financing volatility, most of our public health programs have been supported through programs, the HIV, the TB, malaria, and with the changes, whether in the bilateral or the multilateral agencies, has brought shock waves to our programming. So much so that you find that some of the activities we are ensuring that stability is maintained, but it's a challenge. And of course, some of the transitions, like we have Global Fund, the USG, and others are having challenges, and we are feeling them at the service delivery level. The key recommendations, just to deepen health financing sovereignty, so that we increase domestic financing of our health activities. We activate alternative funding models. We must explore new funding streams for health, and we must fill the HR vacancies where we just replace staff, at least at the beginning. The staff that we have lost through retirement, succession, those ones should be replaced immediately. And we manage succession so that the leadership is also developed as we move along. And of course, the HRH policy, if implemented, will bring a big sanity. And finally, as we focus on primary healthcare, sir, we are asking for optimized participation at the county level, at the community level, so that the ownership is strengthened there. We know that supervision for the community health services is still because of the staff. So we're looking at working with the counties to ensure that we strengthen the supervision, the replacements, and to ensure that just everybody is supported along the value chain. Thank you very much, and I think I want to bring this to an end.
Thank you, Dr. Gondi, for your presentation. Before we bring in Professor Kangu to make his presentation, I would like to...
I can't hear you.
Before we bring in Dr. Kangu to make his presentation, I would like to...
Madam, I can't hear you.
Just a moment. Can I be heard now?
Yes, I can.
Yeah, sorry, I was saying thank you very much, Dr. Gondi, for your presentation, and my apologies to our dear participants. Sometimes these things do happen. I just want to be able to call upon the two PSs, our hosts, our co-hosts for this meeting, starting with our PS for the State Department for Medical Services, followed by the PS in the State Department for Public Health, to just be able to come in and say something for a minute or 2 minutes to the members who are in this meeting, because we have lost about 800 people in this meeting. And in this meeting, it is expected that when people have logged in, that they should remain for the remainder of the time that for this meeting. So it is quite alarming to be able to note that we've lost about 800 people, and I welcome the PSS perhaps to be able to speak to the members from your state departments and encourage them to stay throughout. Dr. Oluga, thank you.
Thank you. Yeah, thank you so much, Linda, and to our Chief of Staff and Head of Public Service. We have noted also the numbers. On our end, there is only one report in terms of who are going to attend clinics, particularly for the referral hospitals. And because there is also a bit of a queue for patients. And I'm just trying to ask the CEOs to get us the exact numbers. So that is the only explanation from our end. I know for Madari, they have mentioned around 190 who are now starting to attend to patients. And I'm waiting to get from the other CEOs how much of this staff are now going to clear the queues for patients.
Linda, I think mine is going to be on a different front. I want to call all the agencies to remain put, especially those who are not active in other roles. But, sir, I want to allow me to express my sincere appreciation for this time and the leadership and the continued commitment to strengthening service delivery across government. This engagement provides us with a very valuable opportunity to reflect on our progress, share achievements, address existing challenges, and also align our priorities with the broader national objectives. Sir, to build a resilient, efficient, and unified system, both levels of government must move from a transactional relationship to a deeply collaborative partnership. And based on the best practices in public administration and the strategic interventions highlighted in your health sector document, intergovernmental operations can be optimized through, one, a unified digital and data systems, because information silos are the enemy of efficiency, and national and county governments should rely on shared interoperable digital infrastructure, centralized reporting. And I can give a good example with the ECHIS, the Electronic Community Health Information System, that is used across all 47 counties. And it ensures that both national policy makers and county level implementers are looking at the exact same data for the community health promoters. So data-driven interventions, again, and especially in public health, shared data allows both tiers of government to identify gaps, track disease outbreaks, and allocate resources based on evidence rather than guesswork. So we are calling upon the county governments and ourselves to ensure that we use data-driven interventions. The second thing is collaboration in terms of policy formulation and legislation. The mandates passed down from the national government without county level input often face fierce resistance or implementation failure, sir. So co-creation of policies and bills should be drafted jointly, and this we have really enhanced the coordination around it. Again, for example, development of regulatory bills in direct collaboration with governments ensures that resulting laws are practical and locally acceptable for both of us. And of course, the standardized frameworks that need to be had around national government and should focus on setting high standards, high-level standards of regulatory framework, like the quality of healthcare and patient safety, a bill that we have come up with that is gonna set an authority. And while counties retain their autonomy to implement those standards in ways that fit their unique regional demographics, then the national government retains the setting of the standards. And that, sir, if I may say, would be the co-financing and shared resources, the resource burdens, because financial friction is a primary driver of intergovernmental conflict. Therefore, establishing clear shared financial commitments ensures mutual accountability. When we need matching funds, for instance, for community health promoters, let the county governments ensure that the community health promoters are paid and paid in time, because this guarantees that both sides have a vested financial interest in the program and the success of the same. Again, the transparent supply chains, because investing in integrated supply chain management systems ensures that resources like medical kits supplies are procured efficiently at the national level, but distributed equitably at the county level. And this has been seen in the case of community health promoters, where we purchased 100,000 kits and they were distributed equitably depending on the population. And finally, sir, the issue, and my director has mentioned addressing human resources disparities. This is a major challenge in devolved systems, and the maldistribution of skilled workers who often cluster in urban national hubs, leaving rural counties undeserved. So the equitable distribution of policies, the national government we are helping the counties to optimize workforce development by ensuring that we manage the pipeline of professionals, and especially with our premier mid-level institution, and also in collaboration with CUE, the Commission for University Education, and capacity building for it. Sir, I want to report that we are steadfast on the postgraduate training of doctors and other cadres. And what we are doing right now is a needs assessment to ensure that we train only those qualified professionals that the counties need, so that while they finish their training, they can go back home and serve. And finally, sir, I want to talk about institutionalized communication forums, the ad hoc meetings that are not enough to sustain long-term alignments. So regular intergovernmental summits. I know the intergovernmental agency works on this, the establishment of formal recurrent engagement platforms where national department heads and county executives consistently review progress. We have our interdepartmental directorate within the State Department of Public Health and Professional Standards. And the interdepartmental department is purely to ensure that there is coordination between county governments and national government, and equally global health security. So joint task forces, and for long complex issues like human resource or emergency preparedness, deploying joint task forces that include representation from both levels of government ensures holistic problem solving. So, sir, I'm very happy that this is happening, and public health remains the cornerstone of achieving our bottom-up economic transformation goals, as prevention is cost-effective and essential for sustainable development. So we are committed to ensuring accountability. We are committed to ensuring efficiency and results guided by data and evidence. I wish to reaffirm our unwavering commitments, sir, to safeguarding the health and well-being of all Kenyans, and to upholding the highest standards of professionalism within the health sector. I thank you, and I look forward to more engagement like this. Thank you.
Thank you very much, Madam PS, and we wish you a safe journey. Madam PS is speaking to us from France, where she's about to take a flight to come back, and we thank you for being able to join us, even as we continue to bring it to the attention of participants in this meeting of their need to be in this meeting until the end. We thank you, Dr. Oluga, even for the information that you are able to provide. I now wish to welcome Professor Mutaha Kangu from the Council of Governors. He's the legal advisor, health, for him to make his comments, speaking to persons within this forum, because we know that for the loop in health to be complete, at the national level and the county levels, there has to be a lot of, working together to be able to make this possible. So Dr. Kangu, welcome. And after Dr. Kangu makes his remarks, I welcome my co-moderator, Mr. James Ntabo from the State Department of Medical Services, to come on board and welcome the representatives of the various entities to be able to speak to us quite briefly. Thank you. And this will be followed by a plenary section. If I may also just inform members within this group, there'll be a short plenary section where if you wish to say something, you can use the icon at the bottom of the screen to be able to raise your hand so that we can see you from this end and enable you to speak during the short plenary section there will be. Thank you.
Thank you so much, Chief of Staff and Head of Public Service, the two PSs, Dr. Oluga and PS Modoni. First of all, I wish to extend my appreciation to...
Prof?
Yes?
Prof, your camera is not on.
Let's see.
Kindly turn on your camera and then proceed. Thank you.
Is it on now? Are you able to see now?
Not yet, Prof, but now we can. Now we can. Thank you so much.
Thank you so much. Now, first of all, I would like to thank the Chief of Staff and Head of Public Service for taking this initiative. And I'm saying this because I am one person who has previously complained that the implementation of our constitution and devolution across board and in the health sector has suffered because as a nation, we did not invest adequately in culture change and change management. And for the head of public to have seen the need to organize this meeting, I really think this is very good. And we need to continue with this because we adopted a constitution and it is incumbent upon us to always identify challenges and fix them, and to engage in conversations with each other with a view to solving the challenges. And so I need to present what is the view of the kinds of governors. Identified a few things here and there. We will look a bit at I can see it doesn't want to move. I don't know what is happening. Let's see. I don't know why it doesn't want to. Okay, fine. I need to begin by pointing out that it's important to know the legal status of the Council of Governors. And I'm saying this because I recently had a member of parliament really describing it as an illegal organization. The Council of Governors is established by Section 19 of the Intergovernmental Relations Act, and it is therefore one of the intergovernmental structures established by legislation. It comprises the 47 governors, and it's supposed to provide a forum through which the 47 county governments can be able to consult on a number of issues among themselves, can be able to share information among themselves about performance in the counties, and can use that to facilitate the capacity building of the governors and their staff. Now, Section 20 of that particular act sets out the mandate of the Council of Governors in great detail. And if you look at it, you will see that the council is for consultation among the county governments, provides a forum for sharing information, considers matters of common interest among the county governments, deals with the disputes that may arise among the county governments, and may facilitate capacity building for governors, and also receives reports and reports from other intergovernmental organizations and oversees and monitors the implementation of inter-county agreements It considers matters that may have been referred to the council by members of the public and provides a solution. It also considers the reports that come from the other intergovernmental forums and performs other functions that may be assigned to it by the legislation. Now, in organization, the council can be looked at from three perspectives. There is the full council, which comprises all the 47 governors. Then the council is divided into committees aligned with the functions and the sectors that are assigned to county governments. And below the committees is a secretariat that supports both the full council and the committees of the council of governors. Now, the council also offers a forum through which the county government officials can be organized into caucuses, like the caucus for the CECs. They have a caucus through which they can be able to discuss their issues. The county chief officers of health also have a caucus. The county directors have a caucus. And those caucuses enable those officers to sit together from all the counties, look at various issues, develop some advisory for the governors to help them to run. Now, those caucuses have chairs, vice chairs, secretary general, and deputy secretary general, as well as a chief whip, who brings them together to discuss important issues. And all the members of these caucuses join and participate in various thematic subcommittees that deal with a number of issues that arise in the health sector. And those thematic teams, all of us may know, include the Human Resources for Health thematic team that has a lot of issues which we need to identify and address. And as I'll be pointing out when I talk about the challenges, we'll be seeing that the HRH area is one of the problematic areas in our devolution, which we need to start thinking about and ask ourselves, how do we address the challenges that are arising? For instance, the need to transfer services of a public servant from one level of government to the other and from one county to another. How do you go about that? Those are challenges we ought to be actually discussing between national government and county governments to decide how do we deal with this kind of situation. Now, we do have a thematic area on service delivery, quality assurance, and standards. There is a thematic area on health information and research. There is a thematic area on health products and supply chain and infrastructure, and another one on health financing, leadership, and governance. So members of these county government caucuses belong to some of these thematic areas where they make contribution on how we deliver health services in our country. Now, the Directorate of Health in the Council of Governors, because as I've said, the council is divided into committees, and one of the committees deals with health, and it is a directorate. And so it deals with a number of issues. Many of you are aware of the fact that we normally organize for a devolution conference, and we also release a state of devolution address to the public to see where we have reached with the devolution. Then, of course, annual reports, which are statutory, are developed by the directorate. Reports of the committee on achievements are normally also developed. Quarterly committee meetings are organized for governors who are in the committee, for CECs, for chief officers, and for directors to enable them to discuss some of the emerging issues. Weekly and bi-weekly coordination meetings are always undertaken by the directorate to be able to look at some of the urgent things to address. And the Health Intergovernmental Forum, the directorate participates in those activities at the forum, and meetings of health sector coordination committees are actually some of the things the directorate deals with, as well as media monitoring and looking at the bills and the bills tracker to see some of the proposed changes in the area of health. Now, the Constitution, we need to note that talking about this, the foundation which we must internalize, both national and county government, is the fact that having created devolution and 2 levels of government, the Constitution assigned the health functions to the 2 levels of government. And I think the previous speakers have spoken about this. And the national government is more in the area of policy, but the county governments are more in the area of service delivery. And it is our wish as the Council of Governors to communicate to the national government that national government in executing its function on policy and legislation needs to make policies and legislations that facilitate county governments in the delivery of services, and not policies and legislations that sometimes erect barriers to access to services and delivery of services. And to do that effectively, therefore, conversations with the users of the policies and the legislations to see whether you are conceptualizing the problem properly are very, very necessary to enable national government, MOH, to develop policies that will actually address the problems on the ground. So conversations with the county government officials are critical to help us as 2 levels of government to be able to address the challenges in health through policies and legislations. Now, we need to bear in mind that since 2023, we have had massive reforms undertaken in the health sector under the Kenya Kwanza government, which reforms were anchored in 4 laws that were enacted in 2023. Previous speakers have already talked about the Primary Health Care Act, the Digital Health Act, the Social Health Insurance Act, and the Facilities Improvement Financing Act. And we need to bear in mind that when these laws were enacted, the main objectives, we were told, included an effort to shift from a concentration on curative health services to a more comprehensive system that includes preventive, promotive, and curative services, as well as rehabilitative services. But we need to point out that in trying to do that, to achieve that shift, there are quite a number of challenges, and we need to bear in mind that sometimes a law may have very nice broad objectives, but sometimes the details we put in place end up undermining the original objective. And I must point out that as we seek to implement our reforms in the health sector through those 4 laws, that is actually one of the problems we are facing today. We said we want to shift from curative to more preventive and promotive. But when we came in with the Social Health Act to provide for financing of health services, we did not provide for coverage of services delivered at level 1. And therefore, level 1, which is very critical in the preventive and promotive services, is not covered. And I know there are conversations going on, I've been involved in them, but at least this is a message to us that when we are doing policies, we really must look at the broad objective carefully and look at the details carefully to see whether the details are actually enabling us to deliver the broad objective or not. Because when we don't do that, we end up with a law and celebrate, but at the end of the day, the reality on the ground is that the objective is not met. So that is something we need to bear in mind going forward as we sort out the current problems we have identified with the Social Health Act and so on. One issue I need to point out, like right now, we are trying to make a policy shift in the area of eye health to ensure that we are now investing more in eye health. But we need to be asking ourselves, what do we need to do to realize that shift? What do we need to do in financing? What do we need to do in personnel? What do we need to do in products to be able to realize that policy shift to invest more in eye health and things like that? Then, of course, we can look at a bit of the achievements that the county governments can be said to have made. If you look at the quarterly consultative forums, we have been having quite a number of them, at which a lot of information is shared among the counties. Lessons that are developed from one county to another are from one county and shared with the others. Now, we must also note that COG has been providing platforms for counties to share best practices and promising practices. The COG has been also providing a forum through which national mentorship webinars for clinical staff and leaders have been undertaken across the country, particularly in the area of maternal health and maternal deaths and so on. Now,
Sorry, members, we're trying to get Professor Kangu back to just complete his presentation in a minute. We're trying to just see what the issue with the sound could be. So I trust that we'll be able to sort it out. But in the meantime, Professor Kangu, when we're able to solve the issue, kindly just come in and complete your presentation so that we can
are you able to hear me now? Are you able to hear me?
Yes, we're able to hear you now. Yes. Professor, we were able to hear you.
Can you hear now?
Can hear you, Professor.
Are you able to hear?
Yes, we're able to hear you, Professor. Kindly wind up your presentation. Thank you.
Thank you so much. So we have made achievements in the area of FIF. The Council of Governors has done quite a lot to get the counties to adopt the new law and work with it. And something has gone wrong with my my slides are not moving. Show.
I'd like to welcome my co-moderator, Mr. Ntabo, from the State Department of Medical Services, to come on board. We shall be able to share the slides by Professor Kangu. We have experienced, I think, a slight problem in being able to have that presentation on, but we now welcome Mr. Ntabo to be able to take us through the rest of the presentation, even as we will definitely share Professor Kangu's presentation. Thank you so much, the Council of Governors, and Mr. Ntabo. Thank you.
Thank you. Thank you so much, Dr. Linda. Our Chief of Staff, who's the chief guest, our two principal secretaries, our DG, and the rest of the members. My name is James Ntabo, Secretary Administration, who will take you through a short session on remarks from selected representatives from the two state departments. This will be a 3-minute each for the participants. And to start us off is Dr. Richard Lesiambe, the acting CEO, KNH. In fact, we told that we can do 2 minutes each. Thank you, Dr. Lesiambe. The floor is yours. A reaction?
Chief of Staff. Chief of Staff and Head of Public Service. I don't know whether you can hear me. Okay, yeah. Once again, Chief of Staff and Head of Public Service, our two PSS, and all those
Sorry,
who are listening.
Dr. Your camera is off.
Please, the host to admit me, please.
You have all the rights to turn on your camera and your sound.
Yes, I think I'm there. Yes. I can proceed?
Yes, please.
Yeah, thank you very much. Once again, the Chief of Staff and Head of Public Service, the two PSS, my colleagues, riding on the established protocol. May I say that on behalf of Kenyatta National Hospital, we are celebrating 125 years of service to Kenyans and the world. And yes, and I would like to progress by saying that this is a great opportunity for us as the National Referrals and Teaching Hospitals to confirm our commitment to ensure that we continue performing as per our mandates. Having been selected as the temporary dean for all the National Referral and Teaching Hospitals, our mandate is very clear to handle and receive referrals from all our hospitals in the country to educate, doctors and train them, and three, to support, particularly in the support, particularly on specialized care. Now, as it has been said, we are talking about the journey for Singapore. And I just want to put this into perspective from where I come from, that we are really talking about a metaphor, an image, a vivid direction of where we want to go, particularly in healthcare. And for us, as a national referral hospitals, we are talking about digitization. We are talking about automating our systems. We are talking about the short periods, of waiting. We are talking about only handling specialized services. And therefore, we are saying that as National Referral and Teaching Hospitals, we want to call upon our colleagues in the county governments to support us, particularly with the primary healthcare. That if we strengthen primary healthcare, and strengthen our referral systems, we can indeed provide impeccable, seamless, and wonderful healthcare services to our Kenyans. So mine is just to say that we are committed as National Referral Hospitals, to ensure that we actually provide excellent, healthcare services to our patients, and particularly specialized healthcare. I think our prayer, and I think my colleagues probably also will probably say one or two things, is to ensure that the referral system is properly established, that we avoid any shortcuts on the same. This will definitely give us an opportunity not to embark on specialist treatment. For example, I think as I summarized, at KNH, for example, we have done 22 kidney transplants last year alone. In total, 290 of them. In fact, we have the capacity to do even more. But sometimes we are forced because of handling other cases which are not probably referral. In terms of even heart surgeries, we have done 609 heart surgeries last year. This is actually the direction we want to take as National Team for Hospitals. In fact, last year also, this year actually, we did 50 cochlear transplants, making the deaf children, in fact, performing the last miracles of Jesus Christ, of making those who cannot hear to hear. We did 50 of them, courtesy of the support of the First Lady, Mama Rachel Ruto, and the Moroccan government. We have the capacity, therefore, as National Teaching and Referral Hospitals, to handle all complicated, specialized management of patients in our country. Thank you very much.
Thank you, Dr. Lesembe, for that brief rejoinder remark. We now have Dr. Wako coming. Dr. Wako from KEMSA will be followed by Dr. Jackson Kioko, CEO KPOA, who will then followed by Dr. Kelly Olwach from the CEO KMTC, And finally, we have Dr. Sultan Matendechere, who will close that floor. So Dr. Wako, the floor is yours. And remember that your camera must be on, please. Thank you, Dr. Wako. Take the floor.
Thank you, SA. The head of public service, our PSS for medical services and public health and professional standards, the Director General, my colleagues, Dr. Linda.
Dr. Wako, we can't see you. Your camera should be on, please.
I don't know. I have clicked the video on, but are you able to see me now? Yeah, I'm not able to verify whether I can be seen. Can I be seen and heard?
Yeah, we can hear you, but we can't see you.
Oh my goodness, am I too dark for this? No?
Proceed, Dr. Wako, please.
My camera is on. Let me get IT. I've put on the camera.
In the meantime, we can have Dr. Jackson. I can see Dr. Jackson Kyoko is already. Dr. Jackson, are you ready? Dr. Wako, have you managed your site issues?
Just put the camera.
My co-moderator, maybe Mr. Wako can finish the presentation without the camera. It's fine. If he's having changes, and then we can proceed. So you have Dr. Kyoko there. So maybe you can proceed, and then Mr. Wako, despite the challenges.
Thank you for that guidance, Dr. Jackson. The floor is yours. Proceed as Dr. Wako works out his challenges.
Thank you, James. Our Chief of Staff, the Head of Public Service, with our chief guests, the two PSAs riding on the established protocols. Good morning. Mine, James, and Head of Public Service is going to be very simple. First is to thank you and appreciate you, sir, for introducing this very noble initiative on the reform agenda, revitalizing the public health service. I think, sir, this is one of the initiatives that I've ever seen in the public service that is going to drive the public service to the next level. Sir, allow me to drum up on the technical presentations that have been made by the two state departments and say that the policies that have been mentioned in this presentation, and especially the primary healthcare policy shift and the strategies with the partnership and collaboration that the Ministry of Health has put in place will not only ensure the achievement of the rights to the highest standards of healthcare, but also the attainment of the universal health coverage for this country. And therefore, Head of Public Service, on behalf of the SAGAs, I would want, under the State Department of Public Health and Professional Standard, I would want to say that the SAGAs have put more efforts and strong commitment to align their respective mandates and work programs with the administrative bottom-up economic transformation agenda through strategic and effective regulations, production of fit-for-purpose human resource for health, and the provision of citizen-centric services to the production of quality anti-venom and anti-snake venom and pharmaceutical products for quality of care and the achievement of the UHC. And therefore, there are issues, maybe there are challenges that I would want to share very, very briefly that are affecting the SAGAs in their performance and effective implementation of their mandate. And one of it that we see is the overlaps of their functions, some of their function and mandate that is causing duplication and inefficiencies in their performance. And number two is about the misalignment of the Mongoso Code of Governance vis-a-vis the statutory provisions of these agencies, in that the board size is
Dr.
in
Kyoko,
most of them is.
Dr. Kyoko, you have 1 minute.
Yes, the board size is usually larger than what is provided in the Mongoso. The last thing is about the cadre-based regulations, which we find at the moment in the country is not efficient and does not provide multidisciplinary practices and patient care services in this country. I submit. Thank you.
Dr. Kyoko. We now move to Dr. Kelly Oluoch, the CEO of MTC, who has 3 minutes.
SA, are you able to see me?
Dr.
now?
Kelly Oluoch, take the floor. Please make sure your camera is also on.
Thank you, Mr. James Tabo, the Head of Public Service and Chief of Staff, sir, the Principal Administrative Secretary, the PS State Department for Medical Services, Dr. Oluga Ouma, the PS State Department for Public Health and Professional Standards, Madam Mary Mudoni, the Council of Governors, my colleagues, good morning. I wish to express my appreciation for the opportunity that I have to be able to do a presentation on behalf of Kenya Medical Training College. Sir, I wish to say and state that from the onset that Kenya Medical Training College has aligned its strategy with the bottom-up economic transformation agenda and is aligning its strategy to the roadmap to Singapore. And specifically, sir, Kenya Medical Training College has aligned its agenda to ensure that the three critical areas that have been highlighted that improve governance and transformation in public service have been adhered to. Particularly, sir, Kenya Medical Training College upholds the highest value of public service by ensuring that we uphold governance principles and ensuring that we operate as per the Constitution, Cap 2, Article 232 of the Constitution. Sir, we are also aligning to ensuring that we provide excellence in service delivery. And also, sir, we uphold the highest quality in training to ensure that we provide premier services to our students and to the general public.
Dr. Kelly, you have 30 seconds.
So I wish to state the following, sir, that KMTC has a strategic plan with the following 4 key result areas that are aligned to the government transformative agenda, that is quality of training, research consultancy and innovation, digital transformation, and institutional sustainability. Sir, in line with that, Kenya Medical Training College appreciates the support that we have received in its mandate to provide fit-for-purpose human resources for health. Sir, I want to highlight the following achievements of Kenya Medical Training College in line with the transformation agenda of the government. First, sir, I want to highlight the consistent, strong performance contracting results that KMTC has achieved over 4 years. That is very good performance. Secondly, sir, we want to express that we are executing our strategic plan and aligned to the government strategic objectives. So we also want to state that we have achieved an increase in our student population and the number of campuses to ensure that our infrastructure suits additional requirements for training in the institution. Sir, I want to highlight the following challenges that KMTC has. First is inability to access student higher education loan board for our students. So we have over
Dr. Loch, because of pressure of time, kindly, I want you to wind up kindly. Dr. Loch.
Thank you, Mr. Ntabo. So the second challenge that KMTC faces is a lack of enough number of lecturers to adhere to regulatory standards. And finally, sir, our students are charged at clinical sites, and this prevents quality training of our students. In conclusion, sir, Kenya Medical Training College aligns its strategy and objectives to ensure that we adhere to strong governance ethics and to enable the institution provide human resources not only for the country, but to ensure that we meet international standards. Thank you, sir.
Thank you so much, Dr. Oloch, and the rest who are doing this. Please understand that we are running short of time, and you bear with us. Next is Dr. Matendechere, and we want to avoid the salutations. Already the protocols have been observed. So, Dr. Sultan, when you come on board, stop saluting our chief guest and the rest. That has been done already. Please proceed, Dr. Matendechere. The floor is yours, and you have 2 minutes. Thank you. Matendechere. Dr. Matendechere, if he's not ready, then we go back to Dr. Wako for his 2 minutes. Dr. Wako of KEMSA, are you ready? Are you?
Yeah, I just wanted confirmation if now you can see and hear me.
Without even the camera, just present.
Okay.
2 minutes.
Yeah, thank you very much. Thank you very much, SA, the head of public service, chief of staff, and PSS. Thank you very much for this very important meeting today. This is a very important platform. Just quickly, 2 minutes. Medicines remain the most visible and tangible expression of a functioning health system. They are what actually patients encounter at the point of care. Ensuring the consistent availability is therefore a shared responsibility for all of us and calls for coordinated planning, timely financing, and collaborative accountability. It is a privilege and a responsibility for all of us to serve in the positions we each hold. Each of us has a unique opportunity to unlock solutions within our respective mandates. At KEMSA, we recognize that our success is deeply interconnected with the work of counties, the ministry, and all stakeholders represented here. We therefore call upon all of us continue working together to unlock the bottlenecks that hinder service delivery. Where there are challenges, let us face them candidly. Where there are opportunities, let us act on them decisively. Structured and institutionalized engagement mechanisms will be critical in enabling this. Over the recent past, as KEMSA, we have made measurable progress proudly in strengthening the health supply chain in the interest of making universal health care coverage a reality. Basically, our order fulfillment rate, as has been said, is over 90%, up from 51% in the previous financial year. Turnaround time has really improved. Procurement lead times, which used to be about 180 days, is about now 60 days, deliberately turning around procurement lead times. These gains are not actually accidental. They're the result of a deliberate shift towards a customer-centric, data-driven supply chain model where procurement is aligned to disease burden, consumption partners, and facility-level needs. So we have said no supplier-driven procurements. It is a need-based procurement that is happening in KEMSA to actualize UHC. So we have actually advanced reforms around product rationalization, pricing discipline, and marketing intelligence, ensuring that we consistently deliver the right products at the right time at the right price and at the right quality, because we need firm commitment on quality and affordability with tangible efficiency gains and improved value for money.
Dr. Wako, you have less than 20
Yes,
seconds, please. Thank you.
Okay, thank you, Ese. Internally, we have strengthened cross-functional collaboration, integrating technical, financial, and quality assurance perspectives into our decision-making processes. So we are very deliberate, as guided by the head of public service, on reforms and data-driven decision-making. This has actually enabled us to be more agile in responding to emerging needs and improve overall system coherence. There are issues that we may need support, but we have to focus on continued collaboration, disciplined execution, shared accountability. Counties, we are pleading with counties to also work with us collaboratively, as said by P.S. Modoni, that it can never be, transactional relationship. Let it be, national and county government collaborative relationships.
Thank you, Dr.
So
Wako.
maybe
Dr.
I
Wako,
stop there in
thank you
the
so
interest
much.
of
Thank you so
time.
much.
Thank you very much.
Closing one word. Dr. Wako.
Thank you, SA. I said, as CEOs, we have to focus on translating policies as guided into tangible outcomes. The policies must reflect in the outcomes. We have to provide stewardship in the execution of public resources, and always remember that universal health care is a core pillar in the bottom-up economic transformation agenda in the socio-economic development of this country. Thank you. I submit.
Thank you so much, Dr. Wako. And of course, I've given an apology that I'm putting pressure so much on our CEOs. You'll understand, please. Next, we go to Dr. Sultan Matendechere. Are you ready, Dr. Matendechere?
Go to the next.
Matendechere, you have 2 minutes. We have Mr. Ibrahim Alio, who will close up, who is from SHA. Dr. We seem not to be making progress with Dr. Matendechere. Allow us to move to the last presenter is Ibrahim Alio, speaking on behalf of Madam Mwangangi, that's from SHA. Ibrahim, the floor is yours, please.
Thank you very much, Ese. Thank you very much, Ese, because of the pressure of time. Chief of Staff and Head of Public Service, our PSS and colleagues who are in the forum with us. I'm Ibrahim Alio, Director of Corporate Services from SHA. Sir, allow me to join the rest of the colleagues in applauding this initiative. It is one of the best initiatives. Thank you so much for this. At Social Health Authority, actually, a state corporation that has been established under Social Health Insurance Act of 2023, we came in to replace NHIF to kickstart actually the transformation agenda in social health insurance through digitization and also through customer focus and customer centric. Here, we actually manage 3 funds, the Social Health Insurance Fund, Primary Healthcare Fund, and the Emergency Chronic and Critical Illness Fund. We have also been given a responsibility to manage Public Officers Medical Fund, where we have actually onboarded major stakeholders like National Police Service, National Prison Service. We have also onboarded teachers through Mwalimu Care. We are also covering civil servants and also some select counties. Sir, here, why we are here basically is to ensure that we provide affordable, accessible, and quality healthcare services to all Kenyans, and that is the major agenda of President Ruto's administration. Ours is to ensure that our main agenda is to ensure that Kenyans get affordable, accessible, and quality healthcare, and that's what we are doing here. So we are basically on transition, and transition means we are transiting from NHIF to SHA, which involves both transition in HR as well as asset and liabilities. Just to give you what we have so far achieved in this transition on HR, sir, we were able to develop and gotten approvals for all the HR instruments and kickstarted recruitment processes, where we have so far recruited 564 staff out of 815 establishments. We are currently concluding the last phase of recruitment, which we're going to be bringing on board officers 1, officers 2, and officers 3, totaling to about 251. Here, we are anticipating to conclude this recruitment by mid-May. So, in terms of in terms of our
Ibrahim, you need to be winding up kindly. You need to be
winding up. I am winding up. In terms of registration, sir, we were able to register over 30.3 million Kenyans. We have also contracted about 11,000 health facilities to ensure that we are able to give Kenyans where they can access services. In terms of payment and processing of claims, we are able to process about 78% of our claims that has been sent to us by our healthcare providers who have provided service to Kenyans. This amounts to about 125 billion. Here at SHA, we are actually working with all stakeholders, all Kenyans, all stakeholders involving healthcare facilities, the county government, the Ministry of Health, to make sure that the lives of Kenyans are actually improved health-wise. So I think because of time, I can conclude it there. We're going to be actually responding to questions that might be coming. Thank you so much.
Thank you,
Moderator,
Ibrahim.
I'm now able to unmute.
Allow me now to take the program back to Dr. Linda to guide us next. Thank you so much.
I'm able to unmute now.
Dr. Linda.
No, just tell me.
Sorry, Dr. Matendechero, kindly proceed and make your comments.
Or is it?
Yeah, please. I don't know if you can hear me now.
Are you now able to do your presentation?
Yes, I'm able to unmute. I was having a bit of a challenge with my unmute function. So
Please,
now I'm
2
able to
minutes there.
unmute. Yeah. All right. Thank you very much. I will spend very little time in light of the circumstances, but just to ride on the protocols that have already been established. I wish to just share that from the National Quality Control Laboratories, this is one of the semi-autonomous government agencies which is charged with the very important function of examining and testing the health products and technologies that we are using, we are relying on to be able to deliver on universal health coverage. I have heard my colleagues who have spoken before me mentioning that it is a very exciting time to be a Kenyan because we have embarked on the journey to Singapore. And it is not possible. I think it's very important for us to state that it is not possible for this journey to be realized if we don't provide the highest quality of healthcare to Kenyans. So this makes the National Quality Control Laboratory one of the critical national health security institutions that need to be very active. So Chief of Staff and Head of Public Service, I would like to report that we are very excited that now we are restructuring the National Quality Control Laboratories so that we can position it to efficiently provide these services. And as I close, in the interest of time, I would just like to say that we are cognizant of the heavy investment of resources that is required to be able to achieve healthcare for all Kenyans. And so at the National Quality Control Laboratories, just like all the other SAGAs, then we are focusing a lot on economic use of resources, ramping up efficiency, which is at the center of the restructuring that we are doing so that this institution can be effective. And finally, HOPS, I would like to thank your office for organizing this particular meeting because it speaks to coordination, which is extremely important in joining the pieces so that we can have a harmonized approach to delivering on Kenyans in terms of the health sector. Thank you very much for giving me this opportunity so that I can present on behalf of the National Quality Control Laboratory. Thank you, and back to you, Ese.
Thank you so much, Dr. Matendechere, for your remarks. Allow me now to take the program back to Dr. Linda Msumba to guide us next. Thank you so much. Back to you, Dr. Linda.
Okay, thank you very much, Ese. In the next section, you want to quickly hear from the participants. And the way we are going to do is if you have any comments or question that you will want to put across, kindly raise your hand so that we can give you the rights to speak and then you can address us. So any person who has a question, please raise your hand up. We're only going to take 5 and then we move on to the next section. So we will start with Esther Wamaitha, followed by Bernard Masita, and then Collins Lando, Dr. Peter Mwethera, and then we finish with Mary Muriu. So in that order, let's please start. Collins Lando, kindly say something. I can see you're unmuted.
Thank you, Dr. I really appreciate the engagement that is being made by the Office of the Public Service, Kosgei, and I appreciate our leadership. My only question is that when it comes to redesignation of staffs who have advanced in their studies, it takes long. And also the promotion of the staffs, it always takes long. For instance, the UHC staffs who are confirmed by the Ministry of Health have been working for now 6 years, and yet they have remained in one job group for 6 years. Kindly, I'm requesting your office if something can be done for them so that they can also be equitable to other staffs working for the ministry. Thank you, and over to you.
Thank you very much, Collins. Next, we go to Esther Wamaitha. Kindly say something. As he prepares weekly for Kenya, I can see you are unmuted. Kindly say something.
Thank you very much to the Chief of Staff and the PSS. I really thank you for being here. So my question is very simple. One, my name is Weekly for Kenya, representing CHESOA, which is Community Health Services and Development Officers Association. One of the key things that we need to address is regarding regulation of community health, so that community health officers and assistants can be regulated. Two, there is a lack of staff establishment for community health officers at the Ministry of Health, and this has been highlighted by the Public Service Commission. The other issue is the approval of the career progression guidelines for community health officers or community health personnel has not been done. Then we also have disparities in terms of payment of health risk and extraneous allowances for community health officers across the different counties. Some counties are getting not getting extraneous allowance and also health risk allowance. The other issue is got to do with funding for community health activities. You realize that we don't have empanelment. If you look at SHA, the modalities to reimburse the efforts by the community health officers and community health promoters is lacking. And also there is lack of inclusion. If you look at the Kenya Health Care Professionals Policy 2026, there is nowhere that community health is appreciated. And also the other issue has got to do with ESP, Economic Stimulus Program. We had community health officers and assistants who served and they are never paid their gratuity. So that issue needs to be addressed. And also, of course, we are talking about UHC, gratuity, and also permanent and pensionable terms. Thank you, and over.
Thank you, Wycliffe, for your comments. Next, we go to Vicky Cherono. Kindly comment.
Thank you very much for this opportunity. I only have two questions that I would like to be addressed. I represent nurses. My question is, I would like to see nurses and other healthcare workers are given opportunity to go and study so that they can be able to offer quality healthcare to Kenyans. Another question is for KMTC. Recently, we have seen that students who are able to get C+ and above, they don't get an opportunity to join KMTC. But there are some students who may have passed to go to university, but they don't like the choices of the courses they were given. For example, maybe they like nurses, but they don't get opportunity in KMTC. I would like KMTC to review that. Thank you.
Thank you very much. The next we go to Lucy Muinde.
Thank you very much for this opportunity. I'm from National Spinal Injury Hospital from the nutrition department. I have two key issues that I would like to highlight. The issue of healthy financing so that we can get enough nutrition commodities in our facilities. And then my second question is about the nutrition officers who work along doctors and all other health care professionals in the hospitals. And these other professionals, they get health risk allowance, but the nutrition officers have not been able to get health risk allowance. We would like also to be considered because we actually see patients who have been referred by the medical officers and even other specialized practitioners. Thank you very much.
Thank you very much, Lucy. We will take three more comments. We will start with Amon Rono, followed by Millicent Atieno, and lastly, Geoffrey Mandela, in that order, kindly. Amon Rono.
Yes. Thank you. Can you hear me?
Yes, we can, loud and clear.
Okay, thank you. Thank you. My name is Amon Kiplimo at MTRH, Moi Teaching and Referral Hospital, Eldoret. I want to thank you for this opportunity and also to just question about our remittance of loans. And also, we have members who have been discriminated in the section of health worker allowance in Moi Teaching and Referral Hospital. Risk allowance also in Moi Teaching and Referral Hospital, we are being paid a flat. I joined this hospital, and I think that is very low, and we get some people who get injured with the or he or she is.
Sorry, we keep losing you, Bwana Amon Rono. Okay, next we go to, sorry.
Another thing.
Sorry, Amon, you have issues with your connectivity. As you try to sort it out, let's go to Millicent Atieno.
Okay, thank you for giving, hello, thank you for giving me this opportunity. I'm Millicent Atieno. I'm from Jaramogi Oginga Teaching and Referral Hospital. I'm a medical psychosocial worker. I wanted to ask a question, especially on specialization, because we find most of us, we have specialized, we have gone to KMTC and we have specialized in HND to offer our clients quality care, and yet I've realized that the government does not recognize that, they don't pay for that, and I've been wondering why is it we need to specialize, offer that care, and yet when we specialize, the government does not recognize or pay for it. Because what they do is you are expected to do diploma, degree, masters, but now in between there, when you go for specialization, you are not paid for that. So that is my concern and question. Thank you.
Hello.
Thank you, Mary Muri. Please proceed.
Okay, thank you for the presentation. I also had some few concerns or questions. One is regarding the organogram which has been shared and under the Directorate of Curative and Nursing Services. So my question is that given that the healthcare delivery, it spans through promotive, preventive and curative, and it involves multiple cadres and beyond the clinicians and the nurses. So I am asking what is the rationale for structuring this directorate as Directorate of Clinical and Nursing Services? How are the other health professionals presented within it? Then the other is on about the core allowance, whereby the nurses are not getting the core allowance, while still they do duties even beyond the normal hours. And the other is on about the nurses who are not directly taking care of patients, or they are not directly in bedside. And when it comes to consideration of nurses, it's more of those who are directly in the bedside. So what about the nurses who have either upgraded or they are working whereby it's more of other activities than bedside? Thank you.
Thank you very much, Mary Muriu. Now, because of time limitations, we'll just take one more from Geoffrey Mandela, but then we continue to encourage you that in case you have a question, please post it on the Q&A section, and our able team is constantly checking and providing answers to the same question. So Geoffrey Mandela, kindly give us your comments.
Thank you for the opportunity. My question would go directly. I'm from the Kenyatta National Hospital, a national referral facility that provides specialized care, teaching, research, and international collaborations. I would like clarification as to whether there is any ongoing reviews on the Health Act 2017 that only recognizes up to level 6 facilities. And yet we have KNH that is already operating as an advanced center of excellence in such care. So are there any frameworks to formally recognize this expanded role? My next question is to regards funding and the limited access to on-source revenues. We all have knowledge that there is the centralized revenue model through the citizen and the treasury that is linked to operational challenges. Are there any reforms considered in restoring financial autonomy and ensure that this institution will be functioning optimally to avoid service delivery disruptions and shortages of essentials? Thank you.
Thank you, Geoffrey. We can see in the Q&A section, there are over 400 questions that have been raised, over 350 answered. So we ask you to again continue posting the questions there. Now I take it back to Ntabo to take us through the next section. Welcome, Ese.
Thank you, Duncan, for taking us through. Thank you, Bwana Duncan, for taking us through that plenary. And we now want to make progress again. We left out Dr. Gregory Ganda. Dr. Gregory Ganda is the CC for Kisumu County, but also the chair of the CC caucus group. And therefore, Dr. Gregory Ganda, welcome and make your remark. You have 2 minutes, Dr. Ganda, please.
Thank you. Thank you very much for the opportunity and all protocols observed. I apologize, I had to leave in for another governor's meeting, but I'm back. I listened to the previous presenters and I agree entirely with what they have said. As counties and CC's focus, we are very supportive of the national government policy that tries to reform the way health sector is done, and we believe that this is actually already happening. As we're already seeing very marked improvements in primary health care. Perhaps my only comment would be about the human resource, which is what most of these people are commenting around here, is that the biggest investment we have as a country is our human resource. Healthcare is 60% human resource, 40% is the rest of the things. And so how do we use this resource to get maximum returns on it? How much extra do we get if we invest $1 extra in the human resource in terms of our health outcomes and outputs? And that's a very important thing that we have to look into, the dynamicity of the human resource and resolution of the human resource. Secondly, we are building a lot. We're spending a lot of money in terms of development in building new hospitals. But we are told that the human resource must not go above 35%. And I say a building is useless without that human resource. And perhaps we need to rethink on what development is, so that if you're putting up a new facility, we need to say that the cost of human resource for that facility for the next 5 years is actually a development expense. Otherwise, we are putting up so many facilities. I can name so many which have been built but are not for operational or are not being utilized by anybody. And so the development does not translate into results. Then we need to think about moving away from the fixed thinking that you have to be a permanent and pensionable. You have to be employed for and work for 4 weeks, so that we fit into what is agreeable. There are people who have very high level of speciality but can only offer us 2 days in a month or 3 days in a month or 1 week in a month. Why not? There are those who want to run their farms and they want to work for 2 weeks in a month. Why not? We need a more dynamic and inclusive human resource policy that allows everybody to be able to be involved. And I think those will be only my comments for now. Thank you very much.
Thank you, Dr. Ganda, for your good remarks. Ganda has always been a good speaker. And before I invite our DG, allow me to make this announcement on behalf of the organizers that all the presentations and recordings of this meeting will be sent to your emails for all the participants who registered. All the presentations and recordings of this meeting will be sent to your emails for you to be able to follow further on that. Now, Dr. Patrick Amoth, who is the technical advisor of government on all matters health. We want to invite him, and as he comes, I also want to recognize Mr. Osia, Principal Administrative Secretary, who is also a friend and our senior. I might not acknowledge at the beginning. So allow me then now to bring Dr. Patrick Amoth, our DG.
Thank you, as Chief of Staff and Head of Public Service. Allow me to read on earlier protocols established. A lot of things have been said from both the two presentations from the two state departments, so I'll just reiterate important facets of areas of focus as a ministry. One area in terms of delivery of health, universal health coverage, of course, is self-financing. We are all aware of the shifting financing landscape and also the geopolitical shifts, meaning a lot of interventions we are going to undertake then will be based on our own domestic resources. And therefore, moving towards government-to-government platforms becomes paramount. Let me also emphasize on the primary healthcare fund, for which I want to applaud the government for allocating 13.1 billion shillings in the current financial year. Because historically, we are told that the best way to be able to achieve universal health coverage is through investment in primary healthcare. And therefore, we are putting our money where our money is, because primary healthcare services tend to be integrated, they tend to be comprehensive, and they promote equity and inclusivity. And through that investment, in the primary healthcare fund, and also investment in our community health care services, we have seen very good dividends in terms of outputs. For example, we have recorded more than 33 million persons screened for diabetes since the onset of the Community Health Promoters Program. More than 21 million people have been screened for hypertension. 14 million children have been screened for common children illnesses like pneumonia, malaria, diarrhea, and malnutrition. Therefore, this investment is yielding the desired results. Number two, in terms of health products and technologies, we cannot be able to talk about Singapore's journey without sovereignty in terms of health products and technology. As a country, as of now, import 70% of our pharmaceutical requirements. This is critical that we invest in local manufacturing so that we can be self-sufficient. Knowing what is happening in the global community, the oil prices reaching the $100 a barrel. Therefore, it means that if you can be able to manufacture locally, you are better off than some people relies on import from a different destination. We need to be able to work together with other state agencies, Ministry of Energy, the National Treasury, Kenya Revenue Authority, Ministry of Investments, Trades, so that we can be able to lay a good foundation for the more than 40 manufacturers who have invested in this ecospace to be able to increase that. We'll be able to increase job opportunities, but also save scarce foreign currency. And in terms of manufacturing, we are not going to only manufacture for our market, but for the region and the global community. Other speakers before me talked about the health workforce, which is the most critical element of any healthcare system. And because we invest 60–70% of our total health expenditure in health workforce, we plead that, like for teachers, we have an allocation so that we can be able to incrementally increase the number of the healthcare workers as our population increases, but also as we undergo an epidemiological transition from communicable to non-communicable diseases. So one of the pleas is that if we can be able to have resource earmarked for recruitment of healthcare workers on an annual basis, because the need for healthcare will definitely increase. Number three is in terms of integrated health management information system. We applaud the Digital Health Agency and share through the work that they have done. Now we can get data real time. If a mother delivers in a facility in Kibich, we should be able to get that data real time, knowing that mother by name, the outcome of that birth, by ID number, and by the sub-county where that mother comes from. This will also save us money in the long term from the periodic 5-year surveys that we undertake to be able to get our data for decision making. I think if we go that direction, we'll be the first country in sub-Saharan Africa that will not rely on the periodic 5-year surveys, but will be able to make a decision based on real-time data generated on a day-to-day, hour-to-hour, minute-to-minute, second-to-second basis. Allow me just to highlight the challenges, including the rising burden of non-communicable diseases. And unfortunately, this is happening to us. We tend to get NCDs at a younger age, meaning we require very long-term care. This is because of the changing lifestyles in terms of the foods that we eat, the sedentary lifestyles that we live, and therefore the need for us to be able to enhance our primary healthcare services so that we can be able to screen for these conditions early, put people on treatment early, and therefore reduce the catastrophic expenditure that is required much later. I also want to emphasize the burden of climate crisis or climate change. We have seen now that mosquitoes breeding in areas where previously were not mosquito areas. And of course, now we saw recently what happened with the rains and the floods and lives that we lost. Therefore, the need for us to be able to enhance our preparedness in the 717 priority and more investment in global health security and health diplomacy so that we can be able to move together as a country and as a region and as a global community. Allow me to finish by welcoming the PS State Department of Medical Services, Dr. Umo Luga, to take over from here. Thank you.
Thank you so much, DG. Again, to Chief of Staff and Head of Public Service. Allow me to write on all the protocols as were established. And thank you, sir, again for this meeting. As we were having this meeting, I was just reflecting some of the staff and some of the health workers who've never had a chance to interact with the caliber of your office, who've never had a chance to be felt and to be recognized for the work that they do in the entirety of the results that we achieve in healthcare. I want to thank you on their behalf because today is it's very momentous that we are having these people listen to government, to you, and this has never happened before. So I want to thank you. And just reflecting on that, somewhere in Nyamira County, there is a Dr. Joel Marwa. He's not a household name. He does not appear on television. He does not even hold press conferences. No one knows about him. He doesn't write opinion pieces, But every week, he sits across from very many patients, some who have traveled very long distances, terrified, most of them very poor. Most cannot even explain their problems very well, but they have come to see him, and they just hope that there will be a guarantee that they find help. And they often do. He examines, he diagnoses them, he operates them, and then they get better. And then they go home. And this is the work of many of our staff in the health sector. Many of them go in, and their reward is just the satisfaction of the patient. When that patient walks out, they don't wait for the applause. It's just the next patient. And so this is the attitude that we have within the health sector. True service, that what we do shows in the result. The person in front of you, that the encounter, that the experience, and the outcome is so personal and that it can't be described. But then also sometimes it's met with a lot of noise because often our staff may have challenges. Often our staff may also not do what is expected. And then that encounter becomes a bad experience, perhaps even a bad outcome. And that is why this meeting was very important. And that's why it's very significant for us, because it ingrains in the minds of all staff that at the end of this talk, at the end of the investments that we make in healthcare, at the end of the policies, everything boils down to the encounter. And that encounter is driven by what they do, their actions. And then today, I think, is the realization that all of us are doing the same thing, whether it's policy formulation, policy implementation, or even leadership, like yourself, leading us to a public service that is performing, that is efficient, that it boils down to the Kenyan feeling like they were served to their satisfaction. And sir, I want to thank you for setting this standard, for holding us to a public service that is efficient, that is accountable, and that is worthy of the first world ambition that His Excellency the President has invited the country to. And that you have not allowed us to confuse this activity with results, but you have enabled us to engage so that we can see that the outcomes Kenyans require are possible. I will not go through many of the investments and the policies and the strategies that our CEOs and our Director General has already mentioned. And there are many, the work that we do. I will just say that we are here to implement, and to all the staff, we are here to implement. We are not here to theorize. We are not here to talk. We are here to implement the vision and the policies of government. And that is why we've been invited to this meeting. So as you leave, for me, is for you to understand what exactly are you implementing and why. All those laws that we have passed, the Social Health Insurance Act, the Primary Health Care Act, the Digital Health Care Act, all those documents that the Director General has talked about, our vision for local manufacturing, for a health workforce that has a proper attitude to serve patients for better experiences and better outcomes. That architecture that we are building, it only works when we implement. But you can't implement what you don't know. So you have to know them. And you can't implement what you don't own. So you have to own them. But we have to implement with zeal, not just mere compliance. And just like Dr. Joel Marwa, every morning, we have to implement, not because someone is watching, but because we want the encounter that is called healthcare to be satisfactory, to be responsive, to be resilient, and to be sustainable. Not just because a report is due, not because the next person is waiting, but because Kenyans deserve nothing short of the full force of everything this government has invested in. And that, for me, is the challenge I put before you. That it all boils down to what you do when you leave this meeting, what you are trained to do, but with an encouragement that even a good thing can be better, that we want to constantly invest in getting better. That is how we achieve efficiency, and that is how we improve on the performance, on the health system's performance. To all this stuff, we see you, we see the work that you put in, and we are here to facilitate you. We are here to enable you with all the tools that allow you to work. But we ask nothing short of the same from you, that you enable us to achieve those results by making the encounter with every Kenyan satisfactory. Because even as we invest in the machines, even as we bring the drugs from KEMSA, even as we put those digital records on the computers and take them through AI formulations, that it will translate to a patient who is satisfied. And it will translate to our resources, multiplying the health of the country, what we call more health for the money. And we are committed in this journey to work with you and to work with you as well as we transform healthcare. I want to thank you for the work that you continue to do, and want to promise that we'll enable you, we'll train you, even in the newer ways of delivering healthcare, so that we can get better. Sir, I think that is all that I have to say. And again, just to assure you of our commitment as a health sector, as a Ministry of Health, and specifically as the State Department for Medical Services, that we will not take the goodwill of His Excellency the President to transform healthcare for granted. We will not take the investments of government to make sure that every Kenyan is served for granted. And we will not take the guidance and the leadership that you have shown us in this standard to engage with our staff so that people feel part and parcel of the change. We will not take that for granted. We will transfer all of that goodwill faithfully to the Kenyan that we serve. That is the calling, and that is only that's the only brief we have for you. With those very many remarks, I would now like to request our staff to, with an applause on the platform, welcome the Chief of Staff and Head of Public Service to now address us. Thank you so much, sir, and welcome.
Thank you, Daktari. The principal secretaries that were able to attend this virtual meeting, Dr. Oruga and Mary, senior government officials, especially in the sector of health, from both state departments, State Department for Medical Services and the State Department for Public Health and Professional Standards, and the staff from Council of Governors and county governments. All officers, right from top doctors to patient porters, social workers, artisans, administration assistants, accountants, nutritionists, and all cadres that were able to log into this meeting today. I want us to reflect on three things. One is the discussion of today is on issues, values, and principles of the public service that we gave ourselves in the Constitution, and also trying to figure out and agree on how to improve performance and efficiency to optimal levels, and finally, as a service provider, is a conscious decision to provide premier services, the public, the quality service, efficiently and in a timely manner. So really, today we are gathered here to have a discussion and also to agree as government officials that it is us who should make a difference in this time and this administration. And let me begin by expressing my sincere appreciation to all of you in the health sector. The work you undertake places you at the very heart of service to the people of Kenya. Every day, you save lives, you protect communities, and uphold the dignity and well-being of our citizens. As one of the most citizen-facing sectors, your contribution is both visible and invaluable, and as government, we deeply recognize and appreciate your critical role. In carrying out this noble duty, many of you make immense personal sacrifices that often go unseen. You work long and demanding hours, respond to emergencies at a great personal risk, and in some instances, place your own health and safety on the line to save others. So the emotional toll of caring for the sick and vulnerable, coupled with the strain on your mental and social well-being, is significant. Yet, despite these challenges, you continue to show unwavering commitment, resilience, and compassion. For this, we do not take you for granted. We honor you, we value you, and we remain deeply grateful for your service to our nation. I also wish to commend the leadership within the health sector at all levels for the steady guidance, coordination, and commitment you continue to demonstrate. Your stewardship has ensured that even in the face of the complex and evolving challenges, the sector remains responsive, focused, and anchored on the service delivery to the people. The direction you provide, the difficult decisions you make, and the support you extend to your teams have not only sustained operations, but have also strengthened confidence across the sector. We recognize and deeply appreciate your leadership. The participants of this meeting today, which are over 7,000, and in line with what I've stated earlier, the kind of sacrifice that you make, it is actually precisely for this reason that this meeting is both timely and critical. As we continue to advance the government's reform agenda and deepen the ongoing campaign across the public service, it is essential that we come together as a sector to reflect, align, and renew our shared commitment. These sectoral engagement provide a platform to take stock of progress, address emerging challenges, and ensure that the reform message is clearly understood and consistently implemented across all levels. More importantly, they allow us to move forward with unified voice, shared purpose, and strengthened resolve to deliver better outcomes for the citizens we serve. As you have seen, today's theme is centering on our collective responsibility as public officers in implementing the constitutional values and principles of public service, improving performance and efficiency to optimal levels, and providing premier services to the public qualitatively, quantitatively, and in a timely manner, is in many ways self-evident. Ladies and gentlemen, these are not new expectations. They are the very foundation of our calling as public servants. Indeed, they speak to what each of you already strives to uphold in your daily work, and therefore require no overemphasis, but rather a continued and strengthened commitment in practice. When we function optimally as a health sector, the impact is immediate, visible, and deeply felt by the public we serve. Citizens experience timely access to care, efficient service delivery, responsive facilities, and a system they can trust in their most vulnerable moments. As a truly citizen-facing sector, we are not only heard about, we are seen, judged, and experienced daily by the people of Kenya. Ours is a sector where outcomes are stark and undeniable. When we work efficiently and effectively, life is preserved, hope is restored, and communities thrive. But when we falter, the consequences are grave and at times irreversible. This reality underscores the weight over responsibility and the critical importance of consistently delivering at our own very best. As government, we remain firmly committed to achieving universal healthcare coverage as a critical and central pillar of our national development agenda. Our goal is clear: to ensure that every Kenyan has access to affordable, quality health services without suffering financial hardship. In this regard, we are advancing key reforms as stated by the PSS, including strengthening primary health care as the foundation of our system, expanding access to essential services, enhancing health infrastructure and digital health systems, and improving governance, accountability, and efficiency in service delivery. The establishment and strengthening of institutions under Taifa Care and related reforms are critical enablers in realizing these objectives. We are, however, fully aware that the health sector continues to face a range of complex challenges. These include emerging and re-emerging diseases, climate-related health risks, workforce shortages and distribution gaps, infrastructure deficits in certain areas, and the dual burden of communicable and non-communicable diseases. In response, we must remain deliberate and focused, strengthening disease surveillance and emergency preparedness systems, investing in the development and equitable deployment of our health workforce, expanding infrastructure and medical equipment, scaling up preventive and promotive health interventions, and enhancing coordination between national and county governments. These efforts are essential in building a resilient, responsive, and future-ready health systems. At the same time, we must confront with equal honesty and firmness a challenge that is self-imposed from within. There are instances where a few among us betray the very oath of service by diverting medicines, misusing resources, or subjecting citizens to unnecessary delays and indignity. When a patient is denied timely care because of negligence, inefficiency, or corruption, the consequences are not abstract, they are real, and they can be fatal. Let it be said without ambiguity, those who, through their actions or inactions, rob citizens of their dignity, their time, or the access to life-saving services are complicit in the loss of life. History will judge such actions harshly, and the law will, without exception, catch up with them. This sector must stand for integrity, accountability, and respect for human life, nothing less. We are equally cognizant that financing remains one of the most significant constraints within the health sector. Limited resources, competing national priorities, and increasing healthcare demands continue to exert pressure on available funding. Nevertheless, the government is taking deliberate measures to address these by enhancing efficiency and accountability in resource utilization, strengthening health financing mechanisms under UHC reforms, leveraging partnership with development partners and the private sector, and promoting innovative and sustainable financing models. Every shilling allocated to the health sector must deliver value, and more importantly, must translate into tangible, improved health outcomes for all Kenyans. The imperative to address these challenges cannot be overstated. At the core, it is about safeguarding national priorities, restoring and sustaining public trust, and ensuring that every intervention within the health sector delivers maximum efficiency and impact. Health is not just a sectoral concern. it is a foundational pillar of socio-economic development. A healthy population is productive, resilient, and central to the success of our national agenda, including the bottom-up economic transformation agenda. Equally, public trust in our institutions is earned through consistent, reliable, and dignified service delivery. When citizens walk into our facilities, they must encounter a system that works predictably, efficiently, and with humanity. Further, when we look beyond our borders, the evidence is clear. Countries that have made significant strides in health outcomes have done so not necessarily because they possess vastly superior resources, but because they have prioritized efficiency, accountability, and strong primary healthcare system. For instance, nations such as Singapore, that spends less per capita than many developing countries, still achieve better health indicators due to disciplined resource use, robust governance, and a relentless focus on results. Kenya cannot afford to lag behind. The health sector should not be left behind in our journey to Singapore. With the resources we commit to health, the outcomes must reflect value, impact, and continuous improvement. This is both a national obligation and a global expectation. So what we are building together is a formidable force of dedicated public servants, an army of professionals united by purpose, discipline, and unyielding commitment to see our country move forward. This is a collective of men and women who understand the weight of their calling, who are prepared to rise above challenges, and who are determined to deliver results that transform lives. It is in this shared resolve, this sense of duty and patriotism, that will drive the success of our reform agenda and secure a stronger, healthier nation for generations to come. At the same time, this journey demands conviction, commitment, and belief in the cause. Those who are unwilling to align with this reform agenda, who are not prepared to uphold the values and standards expected of public service, must honestly reconsider their place within this noble sector. There is no room for indifference or complacency. We must create space for those who are ready to serve, to sacrifice, and to deliver. The challenges before us are significant. They require a team that is fully committed, one that is ready to confront them head on, and to be part of the transformation we seek. Ladies and gentlemen, the expectation of the health sector, just as is the case with all other sectors within the public service, are as follows. The first one is alignment with the government's development agenda, ensuring that the sector fully understands and aligns its programs and activities within the administration's bottom-up economic transformation agenda. Second is reinforcing values and professional standards. The third is mindset and attitude transformation. And the fourth is breaking institutional silos by promoting greater collaboration, networking, and coordination across ministries, departments, and agencies to ensure that government programs are implemented in a coherent and integrated manner. The fifth is citizen-centric service delivery. We expect repositioning public institutions to remain responsive, accessible, and customer-focused, ensuring that government services meet the real needs and expectations of citizens. Next is prudent management of public resources. This one does not require any overemphasis. Emphasizing responsible use of public resources, transparency in financial management, and strict adherence to public finance management principles. And finally, is strengthening monitoring and evaluation, requiring institutions to track, monitor, and evaluate their programs to ensure that government interventions demonstrate measurable impact. These expectations are not in isolation. They speak directly to why the issues confronting the sector must be urgently addressed. They are not intrinsically linked to our national priorities. The trust that citizens place in public institutions and the need to achieve optimal efficiency in service delivery. A health sector that functions effectively strengthens public confidence in government, improves productivity across the economy, and also safeguards the social fabric of our nation. So as we conclude, this message must not end in this room. It must cascade to every level within the state departments, reaching each and every officer across all cadres and duty stations without exceptions. Every leader present bears personal responsibility to ensure that the reform agenda is communicated, understood, and internalized for their teams. Further, all institutions are directed to align their work plans accordingly, strengthen internal accountability mechanisms, and ensure strict adherence to the values and standards articulated. Regular reporting on progress, challenges, and corrective actions must be undertaken with measurable outcomes clearly demonstrated. Let me end by saying 2 or 3 things of graph. Ladies and gentlemen, as we have said, you are in charge of a sector that is critical to the people of Kenya, to the government, and also critical to the whole world. Health sector is not a sector that have a clear boundaries. It's a sector that covers everybody and also affect or have an impact on its neighbors or the world as we speak. We've been observing tremendous progress, and I've seen, and I want to thank the PSS, the CEOs, the management of respective state corporations, the regulators, the staff of institutions in the sector, because for the last 3 years, we've seen tremendous progress. Progress in efficiency, progress in effectiveness, progress in accountability. But we have a monster to confront, ladies and gentlemen, and this squarely sits on the laps of Pharmacy and Poisons Board. Wherever we travel abroad, we are confronted with questions. Why do Kenyan government allow substandard medicine to be sold in Kenya? Many government officials and even private citizens, when they travel abroad for medical services, they are told to throw away the drugs that they bought in Kenya, and they are still prescribed, and they are given the same medicine in those countries. And the reason is, they always say, Kenya's medicine are grossly substandard. Its potency is less than 30%. So the question I'm asking all of us who are here now is, what is happening? When do we start to have a clean and a health environment? Why do we allow sale of substandard drugs and even non-pharmaceutical gear. Why do we do this? So I would want to ask the principal secretaries and the people responsible for oversighting this to begin from there and make a decision to say this market, Kenya is a country, cannot be a market of substandard drugs and its associated paraphernalia. It is a very serious matter. It is affecting the manufacturers in the country. It also is affecting even those exporters from abroad, because when the right drugs, when the genuine drugs are in the market, they are deemed to be very expensive, while for sure, the cheaper brands are the ones that are killing people. So I want to urge State Department of Public Health and Professional Standards, the board, the Pharmacy and Poisons Board, the National Quality laboratory. I think it's called NQCL, led by Mate Dejere, and the other one led by, I think, Dr. Hussein Mohammed. Please sit back and retrace the steps as to where the rain started beating us. It is becoming increasingly expensive for people to access services here because the kind of medicines that they are prescribed does not always meet the standards that are required. So that is number one. And it is very important for us to ensure that we have best drugs, we have better or best services in the country. Secondly, it's about customer handling, patients. We need, again, our nurses, our doctors should also try, and especially the management, should try to ensure that we keep the standards that we've been trained in our respective institutions. We want hospitals to be a happy environment when it comes to service delivery. We want patients to receive best treatment, best even handling itself alone. We want a human face around our officers. We want cleanliness to be there in our own hospitals. We want an organized environment when we visit our hospitals and when we are handling our fellow Kenyans who unfortunately have failed ill. We want to see a transformation in even the areas that do not require money, in areas that requires only some rejigging of how we do things, and things will fall into place as it is. So I want to leave you with those two, and I want to commit that the government is continuously reviewing and ensuring that with the limited resources that we have to focus more on health. We have to resource health. We need to have enough and adequate medical personnel. We need to have equipment. We have to have facilities and infrastructure. We need, again, to ensure that corruption is a thing of the past in our institutions. It is a shame for our officers in these institutions to be people who are peddlers or who are the managers of corruption enterprise institutions that are otherwise respected or otherwise expected to be the best when it comes to ethics. So I want us to, again, try to confront corruption in our institutions, in our payment systems, in our service delivery, in our infrastructure development around our institutions, so that the money that would have otherwise been wasted through corruption is invested in the improvement of our facilities. So those three observations are what I wanted to leave you with. And I want all of us to work together. I want all of us to support this government, because this government means well. This government wants this country to change. And therefore, let there be no ambiguity. Implementation is not optional in what I've said. It is expected. It is required, and it must be evident in the quality, efficiency, and integrity of the services delivered to the people of Kenya. With that, I urge each one of you to return to your duty stations with renewed urgency and purpose. As a nation, we are already behind where we ought to be. We cannot afford to lose even a single additional minute. The task before us is immense, but it is achievable. If we act decisively, diligently, and without delay, let us move with speed, focus, and determination to transform our health sector, and in doing so, transform our country. Ladies and gentlemen, the time for action is now, and we have to stand in the gap and make it happen. Thank you very much. Thank you for attending. Thank you for contributing. Let us go to our respective stations and let us initiate and accelerate transformation wherever we are. Asanteni sana, Mungu awabariki.
Proceed. Thank you, our chief guest and head of public service. We've heard you, sir, loud and clear. This is a time, a call for duty. We've heard you, and as the PS, Dr. Luga said, we shall implement all that we've discussed. On that note, allow me then to invite Madam Damaris Mungai, who will say a word of prayer as we close this very important meeting with the head of public service. Thank you so much. Damaris, over to you for a word of prayer. Thank you. Madam Damaris. Unmute. Damaris, unmute, please.
Yeah. Am I audible now?
Yes, please.
Okay. Let's believe and pray. Gracious and everlasting God, we come before you with grateful hearts at the close of this national engagement on healthcare. We thank you for guiding our discussions, for the wisdom shared, and for the spirit of unity that has brought us together with a common purpose. Lord, we lift every voice that has contributed today, our leaders, practitioners, policymakers, and partners. May the ideas exchanged bear fruit to lead to meaningful actions that strengthen our health systems and bring healing to our communities. We remember those who are unwell, the vulnerable, and underserved. May your compassion inspire us to serve them with dignity, equity, and excellence. Grant us the courage to address the challenges we have identified and the humility to work collaboratively for the greater good. Bless the work of our leaders and all those committed to advancing the healthcare system. May integrity, innovation, and care remain at the center of all efforts. Guide our steps beyond this meeting so that what we have begun here may transform lives across the nation. As we depart, may your peace go with us, your wisdom lead us, and your grace sustain us in all that we do. We offer this prayer in faith and gratitude. Amen, and God bless each one of us. Thank you.
Thank you all and have a good day. Thank you. God bless Kenya. God bless you. Thank you.
Bye bye, everybody. What is this?